ಹಾಗೂ ಡಾಕ್ಟರ್ ಮಹಂತೇಶ್ ಸಹಾಯಕ ಶಸ್ತ್ರಚಿಕಿತ್ಸಾ ತಜ್ಞರು ಹಾಗೂ ನಮ್ಮ ಕಾಲೇಜಿನ ಪ್ರಾಂಶುಪಾಲರಾದ ಡಾಕ್ಟರ್ ಸ್ನೇಹಲತಾ ಜಿ ನಾಡಿಗೇರ್ ಅವರು ವೇದಿಕೆ ಮೇಲೆ ಬಂದು ಆಸೀನರಾಗಬೇಕೆಂದು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ. ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಉಪಸ್ಥಿತರಿರುವ ಗಣ್ಯರಿಗೂ, ಪ್ರಾಂಶುಪಾಲರಿಗೂ, ನನ್ನ ನೆಚ್ಚಿನ ಶಿಕ್ಷಕರಿಗೂ ಹಾಗೂ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಗಮಿಸಿರುವ ಸರ್ವರಿಗೂ ನಮ್ಮ NMKRV ಕಾಲೇಜಿನ ಜೈವಿಕ ತಂತ್ರಜ್ಞಾನ ವಿಭಾಗದ ವತಿಯಿಂದ ಆಯೋಜಿಸಲಾಗಿರುವ ಭವಾನಿ ಸ್ಮಾರಕ ದತ್ತಿ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಜೈವಿಕ ತಂತ್ರಜ್ಞಾನ ವಿಭಾಗದ ಪರವಾಗಿ ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇನೆ. ಸಹಜವಾಗಿ ಯಾವುದೇ ಅನಾರೋಗ್ಯವನ್ನು ಪ್ರಾರಂಭದಲ್ಲಿಯೇ ಗುರುತಿಸಿ ಸೂಕ್ತವಾದ ಚಿಕಿತ್ಸೆಯನ್ನು ತೆಗೆದುಕೊಂಡರೆ ಆರೋಗ್ಯವಂತ ಜೀವನವನ್ನು ಪಡೆದುಕೊಳ್ಳಬಹುದು. ಇಂತಹ ಕೆಲವು ಮಾರಣಾಂತಿಕ ಕಾಯಿಲೆಗಳಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ರೋಗವು ಇತ್ತೀಚೆಗೆ ತುಂಬಾ ಜನರನ್ನು ಬಾಧಿಸಿದೆ. ದೇಹದಲ್ಲಿ ಜೀವಕೋಶಗಳ ವಿಭಜನೆ ಒಂದು ನಿಯಂತ್ರಿತ ರೀತಿಯಲ್ಲಿ ಆಗುತ್ತಿರುತ್ತದೆ. ಆದರೆ ಕೆಲವೊಮ್ಮೆ ಜೀವಕೋಶಗಳ ಒಂದು ಸಮೂಹವು ಅನಿಯಂತ್ರಿತ ಸಂಖ್ಯೆಯಲ್ಲಿ ಉಂಟಾಗಿ ಅಂಗಾಂಗಗಳ ಮೇಲೆ ದುಷ್ಪರಿಣಾಮ ಬೀರುತ್ತವೆ. ಇದಕ್ಕೆ ಕ್ಯಾನ್ಸರ್ ಎನ್ನುತ್ತಾರೆ. ಕ್ಯಾನ್ಸರ್ ಪೀಡಿತ ಜೀವಕೋಶಗಳು ಆ ಭಾಗದಲ್ಲಿ ಸಡಿಲವಾಗಿರುತ್ತವೆ. ದೀರ್ಘಕಾಲದವರೆಗೆ ರೋಗಿಯು ಚಿಕಿತ್ಸೆಗೆ ಒಳಗಾಗದೇ ಇದ್ದ ಸಂದರ್ಭದಲ್ಲಿ ಆ ಕೋಶಗಳು ದೇಹದ ಮತ್ತೊಂದು ಭಾಗಕ್ಕೆ ಹೋಗಿ ಅಲ್ಲಿ ಅಂಟಿಕೊಂಡು ಮತ್ತೆ ಬೆಳೆಯಲು ಪ್ರಾರಂಭಿಸುತ್ತವೆ. ಈ ಭಾಗದಲ್ಲಿ ಆದ ಕ್ಯಾನ್ಸರ್ ಅನ್ನು ಸೆಕೆಂಡರಿ ಕ್ಯಾನ್ಸರ್ ಎನ್ನುತ್ತಾರೆ. ಅದರಲ್ಲೂ ಇತ್ತೀಚೆಗೆ ಮಹಿಳೆಯರಲ್ಲಿ ಸ್ತನದ ಕ್ಯಾನ್ಸರ್ ಹಾಗೂ ಗರ್ಭಕಂಠದ ಕ್ಯಾನ್ಸರ್ ತೀರಾ ಸಾಮಾನ್ಯವಾಗಿದೆ. ಕ್ಯಾನ್ಸರ್ ಬಗೆಗಿನ ಶೂನ್ಯ ತಿಳುವಳಿಕೆಯಿಂದಾಗಿ ಜಾಗೃತಿ ವಹಿಸದೆ ಸರಿಯಾದ ಸಮಯದಲ್ಲಿ ಚಿಕಿತ್ಸೆ ಪಡೆಯದೆ ಕ್ಯಾನ್ಸರ್ ರೋಗವು ಕೊನೆ ಹಂತಕ್ಕೆ ತಲುಪಿ ಮಾರಣಾಂತಿಕ ರೂಪ ಪಡೆಯುತ್ತದೆ. ಧೂಮಪಾನ ಮಾಡುವುದು, ತಂಬಾಕು ತಿನ್ನುವುದು, ಮದ್ಯಪಾನ ಮಾಡುವುದು ಮುಂತಾದ ದುಶ್ಚಟಗಳು, ದೈಹಿಕ ಚಟುವಟಿಕೆ ಇಲ್ಲದಿರುವುದು, ಸ್ಥೂಲಕಾಯ, ಅಧಿಕ ರಕ್ತದೊತ್ತಡ, ಮಧುಮೇಹ, ಅಧಿಕ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಇತ್ಯಾದಿ ಅಂಶಗಳು ಕ್ಯಾನ್ಸರ್ ಅನ್ನ ಹುಟ್ಟಿನಲ್ಲಿ ಪ್ರಮುಖ ಪಾತ್ರ ವಹಿಸುತ್ತವೆ. ವಯಸ್ಸು, ಲಿಂಗ, ಅನುವಂಶೀಯ ಕಾರಣಗಳು, ಜನಾಂಗಗಳು ಇತ್ಯಾದಿ ಮಾರ್ಪಡಿಸಲಾಗದಂತಹ ಅಪಾಯಕಾರಿ ಅಂಶಗಳಾಗಿವೆ. ಇಂಥ ವೇಳೆಯಲ್ಲಿ ಚಿಕ್ಕ ವಯಸ್ಸಿನಿಂದಲೇ ನಿಯಮಿತವಾಗಿ ನಿರ್ದಿಷ್ಟ ಪರೀಕ್ಷೆಗಳನ್ನು ನಡೆಸಿ ಕ್ಯಾನ್ಸರ್ ಬರುವುದನ್ನು ತಡೆಗಟ್ಟಬಹುದು ಅಥವಾ ಪ್ರಾರಂಭಿಕ ಅವಧಿಯಲ್ಲಿಯೇ ಔಷಧೋಪಚಾರ ನಡೆಸಿ ಗುಣಪಡಿಸಬಹುದು. ಆದ್ದರಿಂದ ಕ್ಯಾನ್ಸರ್ ಬಗೆಗಿನ ಅರಿವು, ಜಾಗ್ರತೆ ಜನಸಾಮಾನ್ಯರಿಗಿರುವುದು ಬಹಳ ಮುಖ್ಯವಾಗುತ್ತದೆ. ನಮ್ಮ NMKRV ಕಾಲೇಜಿನ 1994ರಿಂದ 1997ನೇ ಸಾಲಿನ ಪ್ರತಿಭಾನ್ವಿತ ವಿದ್ಯಾರ್ಥಿನಿಯಾಗಿದ್ದ ಶ್ರೀಮತಿ ಭವಾನಿಯವರು ನಮ್ಮ ಕಾಲೇಜಿನಿಂದ BSc ಬಯೋಟೆಕ್ ಪದವಿಯನ್ನು ಪಡೆದುಕೊಂಡರು. ನಂತರ MSc ಬಯೋ ಇನ್ಫಾರ್ಮ್ಯಾಟಿಕ್ಸ್ ಸ್ನಾತಕೋತ್ತರ ಪದವಿಯನ್ನು UKಯಲ್ಲಿ ಪಡೆದುಕೊಂಡರು. ಹರ್ಷಚಿತ್ತದಿಂದ ಕೂಡಿದ್ದ ಇವರ ಬದುಕಿನಲ್ಲಿ ಕ್ಯಾನ್ಸರ್ ಮಾರಕವಾಗಿ ಪರಿಣಮಿಸಿತು. ಭವಾನಿಯವರು 2015ರಲ್ಲಿ ಮೂತ್ರಕೋಶದ ಕ್ಯಾನ್ಸರ್ಗೆ ತುತ್ತಾದರು. ಇಂತಹ ನೋವಿನ ಸಂದರ್ಭದಲ್ಲಿಯೂ ಅವರ ಕುಟುಂಬದವರು ಹಾಗೂ ಸ್ನೇಹಿತರು ಸೇರಿ ಕ್ಯಾನ್ಸರ್ ಬಗೆಗೆ ಜಾಗೃತಿ ಮೂಡಿಸುವ ಸಲುವಾಗಿ 2017ರಲ್ಲಿ ನಿಧಿ ಸಂಗ್ರಹಿಸಿದರು. ಈ ದತ್ತಿಯನ್ನು ಒಳ್ಳೆಯ ಉದ್ದೇಶಕ್ಕೆ ಉಪಯೋಗಿಸುವ ಸಲುವಾಗಿ NMKRV ಕಾಲೇಜಿನಲ್ಲಿ ಅಂದಿನಿಂದ ಪ್ರತಿ ವರ್ಷ ಕ್ಯಾನ್ಸರ್ ಬಗೆಗಿನ ಜಾಗೃತಿ ಚರ್ಚೆ ನಡೆಸಲಾಗುತ್ತದೆ. ಭವಾನಿಯವರನ್ನು ಸ್ಮರಿಸುವ ಸಲುವಾಗಿ ಭವಾನಿ ಸ್ಮಾರಕ ದತ್ತಿ ಕಾರ್ಯಕ್ರಮವನ್ನು ಪ್ರತಿ ವರ್ಷ ಹಮ್ಮಿಕೊಳ್ಳಲಾಗುತ್ತಿದೆ. ಈ ವರ್ಷ ಜಾಗೃತಿ ಚರ್ಚೆಯ ಜೊತೆಗೆ ಕಿದ್ವಾಯಿ ಸ್ಮಾರಕ ದಂತಿ ಸಂಸ್ಥೆಯ ಸಹಯೋಗದೊಂದಿಗೆ 30 ವರ್ಷ ಮೇಲ್ಪಟ್ಟ ಮಹಿಳೆಯರಿಗೆ ಉಚಿತ ಸ್ತನ ಹಾಗೂ ಗರ್ಭಕಂಠ ಕ್ಯಾನ್ಸರ್ ಪತ್ತೆ ಶಿಬಿರವನ್ನು ಆಯೋಜಿಸಲಾಗಿದೆ. ಮಾಡಿದ ಸತ್ಕಾರ್ಯ, ಮೆರೆದ ಔದಾರ್ಯ, ಆನಂದಿಸಿ ಅನುಭವಿಸಿದ ನೆನಪುಗಳ ಮಾಧುರ್ಯ ಎಂದಿಗೂ ಅಜರಾಮರ ಎಂಬ ಸುಂದರವಾದ ನುಡಿಯಂತೆ ಪ್ರಾರ್ಥನೆಯೊಂದಿಗೆ ಇಂದಿನ ಕಾರ್ಯಕ್ರಮವನ್ನು ಪ್ರಾರಂಭಿಸೋಣ. ಪ್ರಾರ್ಥನಾ ಗೀತೆಯನ್ನು ಹಾಡಲು ಲಕ್ಷ್ಮಿ ಮತ್ತು ಸಾಧ್ವಿ ನಾಡಿಗ್ ಅವರನ್ನು ವೇದಿಕೆಗೆ ಬರಮಾಡಿಕೊಳ್ಳೋಣ. ಮತ್ತು ಸಾಧ್ವಿ ನಾಡಿಗ್. ಅದೃಷ್ಟಕ್ಕಿಂತ ವಿವೇಕವೇ ಮನುಷ್ಯನನ್ನು ಆಳುವ ಶಕ್ತಿ ಎಂತಹ ಸುಂದರವಾದ ಹಿತನುಡಿಯಲ್ಲವೇ? ಇದೇ ರೀತಿಯಾದ ಸುಂದರವಾದ ಹಿತನುಡಿಯನ್ನು ನಮ್ಮೆಲ್ಲರೊಂದಿಗೆ ಹಂಚಿಕೊಂಡು ಅತಿಥಿಗಳನ್ನು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತಿಸಬೇಕೆಂದು ಡಾಕ್ಟರ್ ಸ್ನೇಹಲತಾ ಜಿ ನಾಡಿಗೇರ್ ಅವರನ್ನು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ.
A warm good morning to all present here. Today, good morning. We are today assembled here for this very noble cause, to another step towards getting rid of this dreadful disease, cancer. As told by your colleague, this cancer awareness talk is on behalf of BHAVANI Memorial Endowment Fund, which her friends and her parents, I think parents have come today, Dr. Tulzappa has come, her husband, her father and her classmates have together pooled money and generated this endowment fund. And it is to this fund every year, the interest of it, we use it for the cancer lectures. I think this is a third year that we are doing this awareness talk. This year is special for us because we have the apt people in this business kind of thing, that is the KIDWAI Cancer Hospital doctors. So warm welcome to all the doctors who are here. Besides their busy, very, very busy schedule, we can understand they're all doctors and that too cancer specialists. So a very warm welcome. I think a huge round of applause for our doctors who have come today. Dr. Ramesh, Dr. Avinash, Dr. Shruti, Dr. Mahantesh, Dr. Vijay, and many more who are going to join us as caretakers, nurses. So we welcome the whole team of KIDWAI Cancer Hospital here for this very beautiful and noble cause. As I told you, this is on behalf of the BHAVANI Endowment Memorial Fund. BHAVANI was a student just like you, doing her BSc Biotech, sitting amongst you some few years back. And as you know, already told to you, did her MSc abroad and then succumbed to cancer in 2014, 16, and this endowment was done actually quite immediately after that. 17, this endowment was already generated. So her photo is there. We have a minute of silence for praying to her, and then we will start on with this function. Yeah. Thank you. A warm welcome to the Department of Biotechnology, the staff and HOD and the staff of Department of Biotechnology, without whom this function would not have been possible at all. So warm welcome to the staff and the HOD of Dr. Suman, HOD of Biotechnology. All the other faculty members of the other departments, the non-teaching staff who have also been joined here, who are going to take this, who are going to use this facility today of getting the screening of cancer. And last but not the least, welcome to all my students who are here eagerly waiting for this lecture. Thank you once again.
ಧನ್ಯವಾದಗಳು ಮ್ಯಾಮ್. ಅಜ್ಞಾನವೆಂಬ ಕತ್ತಲೆಯಿಂದ ಜ್ಞಾನವೆಂಬ ಬೆಳಕಿನೆಡೆಗೆ ಎನ್ನುವ ಸೂಕ್ತಿಯಂತೆ ದೀಪ ಬೆಳಗುವುದರೊಂದಿಗೆ ಇಂದಿನ ಕಾರ್ಯಕ್ರಮವನ್ನು ಉದ್ಘಾಟಿಸಬೇಕೆಂದು ಮುಖ್ಯ ಅತಿಥಿಗಳನ್ನು ಹಾಗೂ ಪ್ರಾಂಶುಪಾಲರನ್ನು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ. दीपज्योति परब्रह्म दीपज्योति जनार्दना दीपो हरतु मे पापं दीपज्योतिर्नमोऽस्तुते शुभं करोतु कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिर्विनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योति परब्रह्म दीपज्योतिर्जनार्दना दीपो हरतु मे पापं दीपज्योतिर्नमोऽस्तुते शुभं करोतु कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिर्विनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते।
ಶ್ರೀಮತಿ ಭವಾನಿಯವರ ತಂದೆಯಾದ ಡಾಕ್ಟರ್ ತುಳಜಪ್ಪ ಅವರನ್ನು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತಿಸುತ್ತೇವೆ. ಡಾಕ್ಟರ್ ಸಿ ರಮೇಶ್ ಸಾಂಕ್ರಾಮಿಕ ರೋಗ ತಜ್ಞರು, ಇವರನ್ನು ಕಾರ್ಯಕ್ರಮವನ್ನು ಉದ್ದೇಶಿಸಿ ಮಾತಾಡಬೇಕೆಂದು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಕನ್ನಡ ಬರ್ದಿರೋರು ಯಾರು ಇದ್ದೀರಾ ಇಲ್ಲಿ? Is there anybody? Okay. So what I will do is that I will mix up a bit of Kannada and more of English so that I hope all of you can understand. The plan of today's program is that I will be just giving an introductory talk on cancer, followed by a talk by Dr. Vijay, who will just brief you about the cancer problem in the world, in India, and in Karnataka, more importantly, Bangalore. And I will talk a bit about the prevention part of it. Then it will be followed by Dr. Shruti, who is a gynae oncologist. She'll be going to cover up the two important cancers in women, cancer of the breast and cancer of cervix, and maybe in general she would touch upon the common cancers in women as well. And it will be followed by the last lecture by Dr. Avinash, who is a senior medical officer in pediatrics, and he'll be talking about cancers in children. So in KIDWAI we see around 150 to 200 children with cancer every day. So we see around 600 new cancer cases in childhood. He'll be talking to you about that. Yeah. So, and it's at the same time, I'm very happy that I carry some nostalgic memories with this institution. It was way back in 90s. I used to come here as an advisor when Professor China Mukala was the principal. And subsequently I continued with Dr. Muralidhar. I was advising the students of, at that time there was a course on medicinal botany. So I used to handle some sessions on research methods and research. So I carry some nostalgic memories with this institution. And I am more grateful to the benevolent donation of Professor Sir here, who is sitting here. More than the money, I think the feeling behind it is very important. And all of us are the beneficiaries of the benevolence. So my heartfelt thanks to you, sir, for organizing this program through us. We are just an instrument between you and the students. So it was because of you it was possible. And on behalf of my team and my institution, I convey my sincere gratitude to you. Thank you very much, sir. So let me begin my talk. So, what is it? Does it work? Okay. Okay, most of us feel that cancer is something very new and it has come to this world very recently. This slide is just to show you that the disease of cancer has been in existence over millions and millions of years, and this is the first documented evidence of a cancer, a particular type of bone cancer, which was identified about 250 million years old. And the cancer is ancient. Of course, we are new to the cancer. So that's the thing. I think it doesn't take this. Yeah. And I think in the introduction itself, the person who was doing an MC very rightly described what is cancer. So my burden is reduced. So she has said that cancer is mainly because of the uncontrolled proliferation of the cells, which results in tumors. And we should know that 80% of the tumors are not cancerous tumors. Okay, just because somewhere some tumor is there in the body, you don't have to get really worried about it. But at the same time, you should see to it that you consult a doctor to rule out whether it is malignant or not. So this is basically the difference between a normal cell and a cancer cell. Next one, please. So what are the features of a cancer cell? Basically, the cancer cells, being a students of biotechnology, you know very well, they are basically parasitic and useless. They thrive upon what you consume, all the calories, energies, and they start dividing. It multiplies rapidly and destroys surrounding tissues. It will start with, it will be confined to the local area, then it will start rapidly spreading into the surrounding areas, then it can spread to the distant parts of the body. For example, a person having a breast cancer, over a period of time, if not treated, it may spread to the bone, it may spread to the brain or liver. So the main feature of a cancer cell is that it has a tendency to divide and spread to the other organs. Next one, please. Why are we doing all this awareness program for you? Basically to show that the cancer incidence is increasing globally. It is not in one place, all over the world, the cancer disease is increasing. And you can see that in the Western world, there are more male cancers than female cancers. And you will understand that it is the reverse in India. There are more cancers in females compared to males. So that is the reason why we have to be more careful. And luckily, many of the cancers in women are highly curable if detected early. That's an advantage. And you can see that 50% of these cancers, they die eventually. And the mortality is slightly higher in India. More people die because of cancer. And what is going to be the scenario by 2040? We expect there to be about 30 million cancer globally. And it's very interesting to note the common cancers that are seen in the world are slightly different from what we see in India. Okay. So the lung cancer, prostate cancers, colorectal cancers, stomach and liver cancers are common globally. And among females, breast cancers, colorectal, lung, cervix and thyroid cancers are very common. Next one, please. Next slide, please. So what is the scenario in India? If you see in India, we see around 14 lakh new cancers every year. That means 14 lakh new cases are diagnosed. And the prevalence, if you include the old cases also, it will be almost about 3 times. So it will be about something about 35 to 40 lakh cancer cases that are existing at any point of time. You can see that there is a slight female preponderance in terms of cancer. Okay. So the other interesting factor is that unlike in the Western countries, the type of cancers we see in India are very unique. You know, we say that in India, university, we have a lot of diversity. And if you take the Western countries, the type of cancers seen in males and females are almost similar throughout the country. But the scenario in India is very different. In different regions of India, you see different cancers. Okay, this is very unique to our country. For example, if you take cancer of the stomach, it is very common in South India, especially in Kerala, Tamil Nadu and Karnataka. Stomach cancers are very common. And Mizoram and Sikkim, if you take, the stomach cancers are very common, mainly because of the dietary lifestyles of this region. If you take North, Delhi and those places, you see a lot of gallbladder cancers, which is very common there. Gallbladder cancer is the number 1 cancer in the northern part, especially in Delhi. And if you take the northeast, that is Assam, Meghalaya and Punjab, esophageal cancer, that is what we call as a food pipe cancers, are very common in the northeastern part of the country. And we have a nasopharyngeal cancer, which is common in Nagaland, mainly because of the high prevalence of EBV, Epstein-Barr virus. So this virus is one of the common problem there. So you see nasopharyngeal cancers. And if you take thyroid, that's in the southwest like Kerala and Karnataka, thyroid cancers, especially among women, are very common. It is postulated by the Japanese Atomic Energy Commission that the thorium on the river banks of Kerala, the sand in the river banks of Kerala, they are very rich in thorium. And the indoor radon exposures are very common in Kerala. So you obviously have a very high incidence and prevalence of thyroid cancers in that area. So this Japanese group have conducted a 10-year cohort study and they have found that radon exposure is one of the main reasons for increased incidence of thyroid cancers. Okay. Then if you take the tobacco-related cancers, this is a universal problem and more problematic in India. Probably nowhere in the world you see as many tobacco-related cancers in Northeast compared to any other country in the world. So almost about 40% of cancers in men and about 15 to 20% of cancers in women are tobacco-related. The more interesting fact which I wanted to share with you is that the lung cancers among females in Bangalore are increasing. And a recent survey says that the smoking habits among females in Bangalore has almost doubled over the years. So if you happen to drive from KIDWAI towards Bandarghatta Road, you see a lot of software companies, you can see a lot of young women standing outside and smoking. So smoking related cancers are increasing among women, and such increase is never seen in any other part of the country. So that's something, it's a take-home point for all of you. And tongue and mouth cancers are very common, mainly because of the chewing of tobacco. Tobacco is the main culprit, and you don't see chewing habits in many other developed part of the country. Only in India, we see a lot of chewing of tobacco habits. This chewing of tobacco is one of the major reasons for tongue and mouth cancers. And hypopharyngeal cancers, as I said earlier, it is the very common in northeastern part of the country. Next one, please. What's happening now? For the last 40 years, we have been studying the trends of cancers. Bangalore has one of the oldest, KIDWAI has one of the oldest cancer histories in the country. We have data collected for over 45 years. And the lesson we have learned out of these 45 years data is that cancer of the tongue, mouth, colon, rectum, these are the cancers which are increasing over the years. And in women, the breast, ovary, endometrial, and these are the cancers which are increasing over the years. And you can observe that most of these cancers in women are hormone-related cancers, which is directly attributable to the hormonal factors in women in India. Okay. How cancer is caused? Cancer is caused mainly because of the interaction between the gene environment. Cancer is a resultant of the adverse reactions or not having a good chemistry with genetics and your lifestyle factors. What are the cancer risk factors? The first group is that there are biological internal factors, namely the age, gender, inherited genetic defects. These are called as the non-modifiable risk factors. None of us can change the age. None of us can change the gender. So these are the non-modifiable risk factors which are common for all cancers. The second group is the environmental exposure. As I mentioned, it may be the radon exposure or ultraviolet radiation exposure. There are some occupational related cancers like the liver cancers were more common among bartenders and those in the distilleries and alcohol manufacturing industries. And some certain types of cancers are very common in vulcanizing rubber industries. And 80% of the cancers in the population are related to our lifestyle factors. It's a very important message. 80% of cancers are lifestyle related. The rest 20% are either familial or inheritance or through genetics. Okay. What are the lifestyle related factors which are modifiable? These factors are highly modifiable. Tobacco, alcohol, ultraviolet radiation, exposure to sunlight, food related factors such as nitrates and polyaromatic hydrocarbons generated by barbecuing foods. Now Bangalore is the hub of so many barbecues and etc. And all the youngsters are fascinated by this, and this is a message for them. And there are certain cancers which are related to work and living environments. They are the asbestos, Unfortunately, India has not banned asbestos. The Western countries have banned asbestos. And tar and pitch, polynuclear hydrocarbons, some metal compounds. And you know that in India, we cannot survive without plastics. So these plastics, certain chemicals of these plastics are highly carcinogenic, like polyvinyl hydrocarbons, polyvinyl chlorates, which we commonly use it in our day-to-day life. And there are about 15 to 20% of the cancers are related to specific infections, which Dr. Shruti is going to cover in a little more detail. So there is a Helicobacter pylori, which is the main cause of cancer for stomach. So normally, we do ignore with, we had some nice biryani or nice mutton. So we have some gastritis, we always end up taking some antacid tablets, etc. And we assume that this gastritis is because of the food we ate. But what happens is over a period of time, if you continue with this problem, you will develop a kind of a dysphagia for solids, semi-solids and liquids. Then you end up with a medical person who will have to do an endoscopy and say that you have some tumor either in the esophagus or in some part of the stomach. So Helicobacter pylori is one of the pre-cancerous conditions for stomach cancers. And we have a hepatitis B, hepatitis B, hepatitis C, which are mainly common for liver cancers. Then we have a human papilloma virus, which is talked about a lot nowadays, about HPV vaccination. Dr. Shruti is going to elaborate on that. And EBV, Epstein-Barr virus, which is normally found in those who eat the smoked fish and those people who are exposed to eat fungated food products. If you go to Nagaland or Northeast, you can see what they do is that they put the paddy into the water, keep it for 6 months to 1 year, and the fungus is grown on this paddy husk. They scrap that and eat it. It's very common habit there in the Northeast. So this is one of the reasons for the Epstein-Barr virus as well. Then we have certain types of radiations, ionizing and non-ionizing. Ionizing basically includes repeated exposure to X-rays, radon soil. Non-ionized exposure basically involves sun's ultraviolet radiation. And there are certain drugs which can cause cancer, like the certain anti-neoplastic agents. What I mean is that some of the medicines which are used to treat cancer, they themselves may cause cancer, or they may cause a second malignancy in the same person. So certain anti-neoplastic drugs are responsible for certain proportion of cancers, and certain hormones. People who take hormone medicines for hormones, so hormone replacement therapy, etc., they have slightly higher risk of developing hormone-related malignancies such as breast, ovary, and endometrium. Okay. And there are certain medicine which causes immunodeficiency. For any one of us to develop any kind of disease, the immune system has to go down first. So cancer is also a kind of immune compromised disease. So it's very important that we keep our immune system perfect. Okay. Then if you take tobacco, 30 to 60% of all cancers in males are attributable to tobacco habits. When I say tobacco habits, it doesn't mean only smoking. I mean that it is both smoking as well as non-smoking format, like chewing, gutka, pan parag. These are all the things which causes cancer. So in females, luckily it is slightly less, but if our women continue to smoke more and more, probably they'll be competing with men in the number of cases. Okay. Then this is the strongest risk factor for 15 plus years, 15 and other types of cancers. And these are adena cancers. These are the cancers which you see. And if you come to KIDWAI, go around our campus, you can see almost about 1,500 patients per day, out of which about 500 to 600 patients are in adena cancers. It's very common. And these tobacco habits not only cause cancers of various sites, it can cause so many other diseases. Like it may be a cardiovascular disease, diabetes, stroke. So prevention of tobacco is one of the key factors for control of cancer. And as I told you, infection-related cancers are more. And we have 10 to 15% of world hepatitis B carrier in India. We have about 34 million carriers here. And we have about 2.4 million people living with human immunodeficiency virus. And more than 50% of our Indian population are carrying H. pylori infection, which ultimately end up with high incidence of cancer. And most importantly, the unhealthy diets, lack of physical activity and obesity, these are becoming more common in India. And it is estimated that by 2035, India is going to be the obesity capital of the world. So we see the obesity incidence is increasing rapidly in India. This is a matter of concern, mainly with respect to the breast cancer and other hormone-related cancers. And this obesity is very much related with colorectal, breast, stomach, liver, and kidney and endometrial cancers. And 5% of our cancer deaths are due to lack of physical activity. Because now we are machine dependent everywhere. We have a refrigerator, dishwashers, mixer, grinder, etc., etc. And our physical activities are very much restricted. So Indian diet and cancer, because of the very kind of diversity we have, in the north we have a special type of diet, in south we have different kind of diet, and these variations in the diet also may be sometimes risk factors for some of the cancers. And the deep fried cooking at very high temperatures, dried fish, very spicy food, they are all the very important factors. When we say about the esophagus, we say that it's basically the hurry, worry and curry. These are the three factors which are responsible for high incidence of esophageal cancers. Okay? And some of our products which we have been traditionally using, like curcumin, they are supposed to carry some cancer preventive properties. And this is the problem. In India, we have two different problems. Either the people are suffering from malnutrition or the malnutrition. This is one of the important problems in our country. So this is what do we do to prevent obesity? Eat more fruits and vegetables, get enough sleep, do physical exercise, play outdoor games, less TV, drink enough water, stop eating fast food. Very, very important message. And probably you don't see as many McDonald's in US than what we see here in India. So they are selling all their junk to us. And avoid stress. So these are the important factors to prevent obesity. And this is the paradox. We have salt in toothpaste, protein in shampoo, milk, and almonds in soap, but we use pesticides in our food. So unless this gets reversed, people start eating almonds and other dry fruits, okay, and the scene cannot never be reversed. I think I have made certain points very, emphasize certain points. I think if you have any questions, I can answer, or I will call upon Dr. Vijay to continue with his talk. Dr. Vijay, please.
ಧನ್ಯವಾದಗಳು ಸರ್. ಡಾಕ್ಟರ್ ಅವಿನಾಶ್ ಟಿ, ಹಿರಿಯ ವೈದ್ಯಾಧಿಕಾರಿಗಳು, ಕಾರ್ಯಕ್ರಮದ ಕುರಿತಾಗಿ ಮಾತನಾಡಬೇಕೆಂದು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ.
Good morning, everyone. Audible? Yeah. Thank you. I sincerely thank NMKRV management, the head of the institution, the Department of Biotechnology, head of the department, staff, faculty, and students. So before going to my presentation or what I'm supposed to talk, can I ask how many of you are interested in pursuing MSc Bioinformatics? How many of you are interested in pursuing MSc in Bioinformatics or Health Informatics? MSc Biotechnology? Excellent. PhD after your MSc, or if you are given an option to choose MSc and PhD to integrated, how many of you? 1, 2. Excellent, excellent, excellent. Okay. How many of you want to become civil servants after your BSc Biotechnology? 1, 2, 3, 4, 5. Okay. Okay. How many of you want to become political leaders in your future? Yeah, I am here with an ambition, talking to the future political leadership, future executive bureaucratic leadership, future MSc, PhD holders, and entrepreneurs and health informatics personnel. You are the future. You are the future. Probably 4 or 5 years back, if someone says cancer is incurable, or even now cancer is incurable, we give the hope, you give the hope, cancer is curable. And when we start with childhood cancers, the first question would be to a parent, will my child be cured? Will my child be back to as he or she was? Yeah, before continuing, I sincerely apologize to my colleagues and organizers because there's an urgent call from my organization. I had to leave early. I'm presenting here. So I'm here to talk about childhood cancer awareness. I represent my whole department of pediatric oncology and my institute, and I go further. And recently, last month, we have celebrated Women's Day also, and there is a relevance. Every woman can ensure every child with cancer is diagnosed early and ensure that there is an accessibility for the treatment. And here, you students and you teachers of non-medical institutions have volunteered in last 2 years in all the NGO sector and ensured that the cancer care was never hindered. And before going into childhood cancer, no, I don't want to go into a lot of theoretical facts, but still, yes, it is my duty to ensure some facts are driven. Number one, childhood cancers are now emerging as one of the, 1 or 2 causes of childhood mortality because you helped the world, biotechnology, bioinformatics, science world has ensured that you come out with great vaccines, great solutions, infections are coming down, mortalities are coming down. That is the reason we see cancers are one of the, 1 or 2 causes of mortality. And the most common childhood cancers, though theoretically, there is something else. What presents to an institution would be leukemias and lymphomas. And 80% of children with cancer survive. I am saying this, even in India, they can survive. And however, treatment of childhood cancers, yes, there is some long-term morbidity. Probably the scientific world and the medical world together can ensure there are less toxic or no toxic treatments available in future. And if there is any straight question, what is the cause of my child's cancer? I think as of today, we have to honestly say we don't know. But yes, you and we will be given an answer probably within 5 or 10 years from now. And there are some facts and myths and facts which we need to drive home. No, childhood cancer is not contagious, but still we advise the child to be in an isolated environment to prevent infections. And fertility. A child treated for childhood cancer may have fertility issues in future. No, with the current medical technology and science and technology, they have a very good life forward. And lifespan, they do really good. And school achievement, in fact, we have seen children with cancers are more achievers and they are better successful in academics. And socialization, if we support the children with cancers, they have better psychosocial skills or socialization skills. And after treatment, we need to ensure we identify problems early. And future, we need to ensure that they are reintegrated in the society as soon as possible. And stigma, let us ensure that they face no stigma. And diagnosis, let us ensure there is a age appropriate and early diagnosis. And this document released in February, Jan of this year shows what is the childhood cancer's clinical epidemiological profile in all the hospital-based cancer registry. It's available in public domain. Kindly go through. This says around 38,000 children have been diagnosed with cancer in 2021. This is a hospital-based cancer registry. It doesn't reflect the true numbers, but still we can roughly say 2021 being a pandemic year, there was 38,000, or the figures would have been 50,000 or more. It is a question for a debate. Yeah. They are broadly divided as leukemias and malignant bone tumors, lymphomas, CNS tumors, soft tissue tumors, and germ cell tumors and sympathetic tumors. Why I am categorizing this is, you being in the biotechnology domain, you can choose one of these cancers as an area of interest. Probably you can pursue your research starting right from your bachelor's regarding cell lines or whatever in future. And this is a very broad map of state of Karnataka, where the childhood cancers are distributed region-wise: Mysuru region, Belgavi region, Bengaluru region, and Kalaburgi region. And as of today in India, we do not have a national program or a national policy for early diagnosis of childhood cancer and management of the same. However, the World Health Organization has come out with a module way back in 2014. Now India is in the process of creating its own document. Probably in one year or two, childhood cancers would be seen as a public health problem. Probably more science and more research can be concentrated over this. And there is a letter from Government of India where Rashtriya Bal Swasthya Karyakramam can be used for early diagnosis of childhood cancer. Probably you from the academia, but as a students, your NSS wings can take up childhood cancer awareness as one of their priorities in the coming years. And this is another letter from Government of India that they would be creating a national childhood cancer policy. This is a table where we have adopted from the World Health Organization. Keeping Indian needs in mind, there is something known as IMNCI, Integrated Management Neonatal Childhood Illnesses, where an Anganwadi worker, ASHA worker at grassroots level is trained to pick up problems in a child and start the referral pattern. This is a red flag. Any of this signs here need an immediate referral. Please ensure the child is admitted immediately in the nearest pediatric health facility. Let us not waste time in sending the child to a cancer facility only, referring the child to a medical hospital only. Ensure the child is admitted in the nearest pediatric healthcare facility. In government level, the facility starts from Taluka Health Center. In private hospitals, it starts from the nearest private hospital wherever the pediatric department exists. So please don't neglect any fever going on for more than 7 days without any apparent cause. Please don't neglect any headache in any child. Even a 2-year-old child, 3-year-old child can say a child has headache. And whenever there is headache with some or other symptom like early morning awakening, vomitings in the night, please don't neglect. And there is a pain. Child says, child has bony pain. They very classically they describe, kaal nauta ide, kai nauta ide, mole nauta ide. So let us not say, illa, biliyod magu, growing pains. No, let us not neglect. Please ensure that the child is referred immediately to be seen by the pediatrician. And petechiae bruces. What is this petechiae bruces? Sometimes on our skin we see some red spots or bleeding like spots. It could be because of some malignancy or some other disorder presenting like with this problem. So it can be another severe disease. Please refer immediately. And leukocoria. Whenever you see a child, sometimes when you take a photograph, you can see one of the eyes having a red spot, and another eye not having it, something like that. And photos are there. And strabismus. In some of the South Indian cultures, whenever there is strabismus, in Kannada, strabismus is in Telugu we say melakanu. Whenever there is strabismus, they say it is lucky. No, let us not view that squint. Let us not view it as a lucky thing in the child. Let us immediately refer the child. More so when it is a new onset. Eyes were normal, but now you see squint. Please refer. And the eyes are of different color. The iris is of different color or new onset difference. Please refer immediately. And there is a blood in the eyes. It's something like bleeding you see in the eyes. The child is otherwise active. Even then, please refer. And there are some swellings over the neck, swelling over the axilla, lymph node swellings. Please refer. And most important, acute neurological symptom, swaying, lack of balance, lack of loss of power in one of the limbs or more than one limb, please refer. And visual disturbances. Child very clearly says, I'm able to see 2 objects, I'm not able to see properly, please refer. So, whenever you see mass protruding, like in one end of the abdomen or one half of the abdomen, you see something like protruding, you feel a mass. When you touch the abdomen, it could be malignancy, please refer. Yeah, and yeah. Next slide. Okay. This is something like yellow, red we have done. So red is a danger signal. Now we have yellow where the child has loss of appetite, child is feeling weak, fatigability. You don't know the reason why the child is not active. And there are some swellings over the neck. And there is some, something like we feel it may be infection, a mass is there, but still please refer the child to the pediatrician. If the child doesn't get fine in 14 days, the pediatrician will suspect malignancy and refer appropriately. And as Ramesh sir has very clearly told, any child coming to you during any of your visits, for example, you are in a community, you are helping, like a camp is going on, you are in such a camp, a normal child comes, however, you ensure that the child undergoes regular immunization as per the schedule, and please counsel the family to stop tobacco use in the family, not just stop, if you say stop exposing the child to the tobacco, the father, grandfather or someone smokes outside the house and comes, he said no, tell them to stop tobacco usage, both smoking and chewing. And some of the things which you need to immediately pick up, if you look at the hands and you compare your hands, I mean, assuming that your hemoglobin is good, more than 11, 12, and your hands are pink or less pink or whatever, depending on your hemoglobin, but the child's hands are very pale, please, it's a warning sign. And such type of lymph nodes, even if it is a small infection and just within 2 days you are seeing such a mass in the neck, please immediately refer. And these advanced, this is how we see in KIDWAI. Like every alternate child who comes with such swelling comes with this or a bad advanced disease only. But any inequality you see in the face, you see an enlargement, something like this, please immediately refer. Even it could be a simple mumps also, please refer. And this is a very common thing, especially you see such sort of seborrhea, dermatitis or dandruff in a newborn baby or in an infant. It is not normal. Please immediately refer. It could be one of the cancers or some other severe disease. And this is very important. This more so when you take photographs and you see in one of the eyes, there either something like this or you have some other white reflex or red reflex. It is abnormal. It is signs of retinoblastoma, one of the common cancers in children. And this child has the disease in both the eyes. It can be picked up with a very good photograph. If you don't see with your naked eyes, some of the apps now both in Play Store and the Apple are now available to pick up a white reflex. It could be cancer or some other disease. Yeah, same things. And this sort of abdominal distension is more very clearly, it's a mass in the child. It could be renal mass, liver mass or anything else, please refer. And this is a knee swelling, advanced disease, but if you see a slightest knee swelling, it could be a cancer, it could be some infection, please refer immediately. And this is still a draft where Government of India is working upon. Whenever in a camps like this, you see a child with some or other signs of cancer, possible cancer or could be cancer or severe disease or some disease, such forms should be made available. Just tick the appropriate columns and you can refer the child to the nearest public health facility where pediatrics is available. And this is a table where we have drawn in, where if the child is red, falls under yellow, falls under green, what should be done? Immediate, primary healthcare system, whether it is a camp like this or a mobile health unit or Anganwadi school and PU colleges, 0 to 18. Across these systems, you can pick up cancers. And yes, some of the cancers, or some proportion of cancers, or if not cancers, some other pediatric disorders where cure is yet to be found. We cannot say there is no cure, so we will let go of the child. No, we need to give some or other holistic care. Let it be symptomatic medical treatment. Let it be supportive care. Let it be some or other support to the child or to the family. We need to continue. And this is a roadmap where we have drawn, where exactly you come under the civil society organizations, you come under scientific research organizations, you can help in finding the cure, research, or even you can start a project immediately. There is no need to start a research study. You can start with a meta-analysis of genetic landscape of infant leukemias. With this, 1 year from now, you can start a cell line study, or you can go ahead coming out with much more information. So WHO has taken up 6 childhood cancers. They have taken up this as a priority. They want to ensure across the globe 60% of childhood cancers there is a survival. Survival is the child survives and lives as other person. And yeah, the message what I want to give through this forum is, yes, exclusive breastfeeding for 6 months, continued breastfeeding for 2 years of age has shown a protective benefit against cancers. And we cannot prevent childhood cancers, but yes, let us promote healthy lifestyle from childhood so that in adulthood we are able to prevent cancer. Sir has spoken about obesity, sir has spoken about tobacco and vaccination. Ensure that every vaccination available on the globe is accessible to the child, and avoiding risky behaviors, and ensure that child gets medical care even for slightest of the problem. So you as civil society, you as scientific society, we can partner with the government, partner with institutions using the platforms available. And yes, now Ayushman Bharat Digital Health Mission has opened up its digital platform for non-medical organizations, scientific non-medical organizations to come and participate in the research and whatsoever. So here we have the answer. IISc is already starting a medical college. Now they are going to come up with the MD PhD program. Probably you can partner with similar organizations or other organizations coming out with the integrated program. And you can help in better survival. This is known as tree of life, where there are 10 roots, where there is every handprint depicts every child with cancer. Yeah, and this is my department, and I am thankful to my women faculty and my women seniors staff, who are the backbone of our department, and ensure that we are able to deliver the best possible to our patients. Thank you. Any questions? Any questions? Okay, I end here anticipating much participation from the students and the faculty, and we collaborating with you in way forward for finding both cures and even prevention of childhood cancers. Thanks a lot.
ಧನ್ಯವಾದಗಳು ಸರ್. ಡಾಕ್ಟರ್ ವಿಜಯ್, ಸಹ ಪ್ರಾಧ್ಯಾಪಕರು, ಇವರನ್ನು ಕಾರ್ಯಕ್ರಮದ ಕುರಿತು ಮಾತನಾಡಬೇಕೆಂದು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ.
Good morning to all. I am just take forward of Dr. Ramesh sir speech. This is also more about cancer burden. Yeah, Ramesh sir clearly mentioned burden of cancer globally and in India. In ಕರ್ನಾಟಕದಲ್ಲಿ ನೋಡೋದಾದರೆ ಸುಮಾರು 85,000ಕ್ಕಿಂತ ಅಧಿಕ ಪ್ರತಿ ವರ್ಷ ಕ್ಯಾನ್ಸರ್ ಕೇಸಸ್ನ ನಾವು ರಿಜಿಸ್ಟರ್ ಮಾಡ್ತೀವಿ. ಯಾವುದೇ ನಿರ್ದಿಷ್ಟ ಸಮಯದಲ್ಲಿ ಸುಮಾರು 2,30,000ಕ್ಕಿಂತ ಅಧಿಕ ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳು ಕರ್ನಾಟಕದಲ್ಲಿ ಸಿಗ್ತಾರೆ. ಮತ್ತು ಬೆಂಗಳೂರಿನ ಪರಿಸ್ಥಿತಿ ನೋಡೋದಾದರೆ ಸುಮಾರು 14,000 ಹೊಸ ರೋಗಿಗಳು ಪ್ರತಿ ವರ್ಷ ರಿಜಿಸ್ಟರ್ ಆಗ್ತಾರೆ. ಹಾಗೂ ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ ಪ್ರಮುಖವಾಗಿ ಪುರುಷರಲ್ಲಿ ಕಂಡು ಬಂದರೆ, ಮಹಿಳೆಯರಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಮತ್ತು ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ ಪ್ರಮುಖವಾಗಿ ಕಂಡುಬರುತ್ತೆ. ಇನ್ನು ಕಿದ್ವಾಯಿ ಸ್ಮಾರಕ ಸಂಸ್ಥೆಯು ದೇಶದ ಹಲವಾರು ಕಡೆಗಳಿಂದ ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳು ಕಿದ್ವಾಯಿ ಸ್ಮಾರಕ ಸಂಸ್ಥೆಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ಗಾಗಿ ಬರ್ತಾರೆ. ಇದರಲ್ಲಿ ಮುಖ್ಯವಾಗಿ ಬೆಂಗಳೂರಿನ ಸುತ್ತಮುತ್ತ ರೀಜನಲ್ ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ ಆಗಿದ್ದರಿಂದ ಬೆಂಗಳೂರು ಸುತ್ತಮುತ್ತ ಹಾಗೂ ಆಂಧ್ರ ಪ್ರದೇಶ ಅಂದರೆ ಸುಮಾರು 87% ರೋಗಿಗಳು ಕರ್ನಾಟಕದವರೇ ಬರ್ತಾರೆ. ಇನ್ನು 13% ರೋಗಿಗಳು ದೇಶದ ಇತರ ಭಾಗಗಳಿಂದ ಬರ್ತಾರೆ. ಇನ್ನು ಕ್ಯಾನ್ಸರ್ ಟ್ರೆಂಡ್ ಬಗ್ಗೆ ನೋಡೋದಾದರೆ ಆಗಲೇ ರಮೇಶ್ ಸರ್ ಹೇಳಿದರು, ಇದು ನಿಜವಾಗ್ಲೂ ಆತಂಕಕಾರಿ ಅಂಶ ಆಗಿರ್ಬೋದು. ಕಾರಣ ಪ್ರತಿ ವರ್ಷ ಪುರುಷರಲ್ಲಿ 0.7% ಕ್ಯಾನ್ಸರ್ ಇನ್ಕ್ರೀಸ್ ಆಗ್ತಾ ಹೋಗ್ತಿದೆ ಮತ್ತು ಮಹಿಳೆಯರಲ್ಲಿ 0.6%. ದಟ್ ಮೀನ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ 1% ಕ್ಯಾನ್ಸರ್ ಪುರುಷ ಮತ್ತು ಮಹಿಳೆಯರಲ್ಲಿ ಇನ್ಕ್ರೀಸ್ ಆಗ್ತಾ ಹೋಗ್ತಿದೆ. ಇನ್ನು ಯಾವ್ಯಾವ ಅಂಶಗಳು ಕ್ಯಾನ್ಸರ್ ಕಾರಣಕಾರ ಅಂಶಗಳು ಅಂತ ನೋಡೋದಾದರೆ, ಮೊದಲನೇದಾಗಿ ಟೊಬ್ಯಾಕೊ. 35% ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳು ಟೊಬ್ಯಾಕೊ ಅಥವಾ ಸೇವನೆ ಅಥವಾ ಜಗಿಯುವ ಟೊಬ್ಯಾಕೋ ಏನಂತ ಕರಿತೀವಿ, ಚೀವಿಂಗ್ ಟೊಬ್ಯಾಕೋ ಏನಂತ ಕರಿತೀವಿ, ಅದು ಉಪಯೋಗ ಮಾಡ್ತಿರ್ತಾರೆ. ಮತ್ತು ಡಯೆಟ್ ಪ್ರಮುಖ ಪಾತ್ರ ವಹಿಸ್ತದೆ ಕ್ಯಾನ್ಸರ್. ಇದರಲ್ಲಿ 30% ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳು ಡಯೆಟ್ನಿಂದ ಬರುವಂತಹ ಕ್ಯಾನ್ಸರ್ ಆಗಿರ್ತಾರೆ. ಮತ್ತು ಸೆಕ್ಸುಯಲ್ ಆ್ಯಂಡ್ ರೆಪ್ರೊಡಕ್ಷನ್ ಇಂದ 25% ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳು ಆಗ್ತಾರೆ. ಇದು ಸೆಕ್ಸುಯಲ್ ಆ್ಯಂಡ್ ರಿಪ್ರೊಡಕ್ಷನ್ ಬಗ್ಗೆ ನುರಿತ ತಜ್ಞರಿದ್ದಾರೆ, ಅವರು ಮಾತಾಡ್ತಾರೆ. ಇನ್ನು ಆಲ್ರೆಡಿ ರಮೇಶ್ ಸರ್ ಹೇಳಿದ್ರು, ವೈವಿಧ್ಯ ಜಾಸ್ತಿ ನಮ್ಮದ್ರಲ್ಲಿ ಇಂಡಿಯಾದಲ್ಲಿ. ನೋಡಿ, ಡಿಫ್ರೆಂಟ್ ಟೈಪ್ಸ್ ಆಫ್ ಟೊಬ್ಯಾಕೋ ಇದೆ. ಫ್ಲೂ ಟೊಬ್ಯಾಕೋ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಕರಿತೀವಿ, ಅಥವಾ ಬಿಡಿ ಟೊಬ್ಯಾಕೋ ಅಂತ ಕರಿತೀವಿ, ಸ್ನಫ್ಸ್ ಕರಿತೀವಿ. ಬೇರೆ ಬೇರೆ ದೇಶದ ಬೇರೆ ಬೇರೆ ಪ್ರಾಂತ್ಯದಲ್ಲಿ ಬೇರೆ ಬೇರೆ ತರಹದ ಟೊಬ್ಯಾಕೋನ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ನಾಗಾಲ್ಯಾಂಡ್ ತಗೊಳ್ಳೋದಾದ್ರೆ ಸ್ನಫ್ ಟೊಬ್ಯಾಕೋ ಜಾಸ್ತಿಯಾಗಿ ಯೂಸ್ ಮಾಡ್ತಾರೆ, ಅದರಿಂದ ಅಲ್ಲಿ ನಾಸೋಫ್ಯಾರೆಂಜಿಯಲ್ ಕ್ಯಾನ್ಸರ್ ಹೆಚ್ಚಾಗಿ ಕಂಡು ಬರ್ತದೆ. ಇನ್ನು ಈ ಭಾಗದಲ್ಲಿ ಈಸೋಫ್ಯಾಜಿಯಲ್ ಕ್ಯಾನ್ಸರ್ ಆಗಿರ್ಬೋದು ಅಥವಾ ಓರಲ್ ಕ್ಯಾನ್ಸರ್ ಜಾಸ್ತಿ, ಯಾಕಂದರೆ ನಾವು ಚೀವಿಂಗ್ ಟೊಬ್ಯಾಕೋಸ್ನ ಜಾಸ್ತಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಆದ್ದರಿಂದ ಈ ಕ್ಯಾನ್ಸರ್ಗಳು ಜಾಸ್ತಿ. ಇದು ರಿವರ್ಸ್ ಸ್ಮೋಕಿಂಗು. ಆಂಧ್ರದಲ್ಲಿ ಹೆಚ್ಚಾಗಿ ಯೂಸ್ ಮಾಡ್ತಾರೆ ರಿವರ್ಸ್ ಸ್ಮೋಕಿಂಗ್, ಅಂದರೆ ಬೀಡಿಯನ್ನು ಉಲ್ಟಾ ಇದು ಮಾಡಿಕೊಂಡು ಸೇದೋದು. ಇದರಿಂದ ಕ್ಯಾನ್ಸರ್ ಬರುವ ಸಂಭವ ಅತಿ ಹೆಚ್ಚಾಗಿರ್ತದೆ. ಇನ್ನು ಪ್ಯಾಸಿವ್ ಸ್ಮೋಕಿಂಗ್, ನಾನು ಸಿಗರೇಟ್ ಸೇದಲ್ಲಪ್ಪ, ನನ್ನ ಕ್ಯಾನ್ಸರ್ ಬರಲ್ಲ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಕೆಲವರು ಅಂತಾರೆ. ಮನೇಲಿ ಯಾರೇ ಸಿಗರೇಟ್ ಸೇಲಿ, ನಿಮ್ಮ ತಂದೆ ಅಥವಾ ತಾಯಿ, ಬೇರೆ ಯಾರ ತಾತ ಯಾರೇ ಯೂಸ್ ಮಾಡಿದ್ರು ನಿಮಗೂ ಕ್ಯಾನ್ಸರ್ ಬರುವ ಸಂಭವ ಸೇದೋರಷ್ಟೇ ಇರುತ್ತೆ. ಆದ್ದರಿಂದ ನಿಮ್ಮ ಇವತ್ತಿನ ನಾವು ನಿಮ್ಮನ್ನ ಕರೆಸಿ ಮಾತಾಡ್ತಿರೋ ಉದ್ದೇಶ ಏನು ಅಂತಂದರೆ, ನೀವೊಂದು ಸ್ವಲ್ಪ ಆಕ್ಟಿವ್ ಆಗಬೇಕು. ಮನೆಯಲ್ಲಿ ಸ್ಮೋಕಿಂಗ್ ಇದು ಮಾಡಿದ್ರೆ ಬಿಡಿಸೋ ಅಂಥದ್ದಾಗಲಿ, ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಅರಿವು ಮೂಡಿಸೋದಾಗಲಿ, ಇದು ನಿಮ್ಮ ಕರ್ತವ್ಯ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಇನ್ಮೇಲೆ ಪರಿಗಣಿಸ್ಬೇಕು. ಇನ್ನು ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳೋಕ್ಕೆ ವೆದರ್ ಸ್ಮೋಕಿಂಗ್ ಅಲೋನ್ ಕಾಸಸ್ ಕ್ಯಾನ್ಸರ್, ಚೀವಿಂಗ್ ಅಲೋನ್ ಕಾಸಸ್ ಕ್ಯಾನ್ಸರ್ನ ನಾವು ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳೋಕ್ಕೆ ಇತ್ತೀಚಿನ ದಿನದಲ್ಲಿ ಒಂದು ಸಂಶೋಧನೆ ಮಾಡಿರ್ತೀವಿ ನಮ್ಮ ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲೇ. ಇದರಿಂದ ಬಂದ ಪ್ರಮುಖ ಅಂಶ ಏನಂತ ಅಂದರೆ, ಸ್ಮೋಕಿಂಗ್ ಮಾಡಿದ್ರೆ, ಯಾವುದೇ ರೀತಿ ಸ್ಮೋಕಿಂಗ್ ಇರ್ಬೋದು, ಚೀವಿಂಗ್ ಇರ್ಬೋದು, ಅಥವಾ ಯಥೇಚ್ಛವಾಗಿ ಆಲ್ಕೋಹಾಲ್ ಸೇವಿಸುವುದರಿಂದ ಕ್ಯಾನ್ಸರ್ ಬೇರೆ ಅಂಶಗಳಿಲ್ಲದಲ್ಲೂ ಬರ್ಬೋದು ಅನ್ನೋದು ಸಾಬೀತಾಗಿದೆ. ಹಾಗೂ ನೀವು ಸಪೋಸ್ ಕಾಂಬಿನೇಷನ್ ಸ್ಮೋಕಿಂಗು ಮತ್ತು ಚೀವಿಂಗ್ ಮಾಡ್ತೀರಾ, ಅದರಿಂದ ಕ್ಯಾನ್ಸರ್ ಬರುವ ಪ್ರಮಾಣ ದುಪ್ಪಟ್ಟಾಗ್ತಾ ಹೋಗುತ್ತೆ. ನೋಡಿ, ಮೊದಲನೇದ್ರಲ್ಲಿ ನೋಡಿದ್ರೆ ಸ್ಮೋಕಿಂಗು ಮತ್ತು ಚೀವಿಂಗ್ ಎರಡೂ ಮಾಡೋದ್ರಲ್ಲಿ ಅದು ಆಲ್ಮೋಸ್ಟು 4 folds ಮೋರ್, ದಟ್ ಮೀನ್ಸ್ 4 ಪಟ್ಟು ಕ್ಯಾನ್ಸರ್ ರೋಗಕ್ಕೆ ತುತ್ತಾಗುವ ಸಂಭವ ಹೆಚ್ಚಾಗಿರ್ತದೆ. ಇದೇ ರೀತಿ ಸ್ಮೋಕಿಂಗು, ಚೀವಿಂಗ್, ಆಲ್ಕೋಹಾಲ್ ಈ 3 ಮಾಡೋದ್ರಿಂದ 6ರಷ್ಟು ದುಪ್ಪಟ್ಟಾಗುತ್ತೆ ಕ್ಯಾನ್ಸರ್ ಬರುವ ಸಂಭವ. ಆದ್ದರಿಂದ ಒಂದು ಸಿಗರೇಟ್ನ ಬಾಯಿಗಿಕ್ಕೊಳ್ಳೋಕ್ಕಿಂತ ಮುಂಚೆ ದಯವಿಟ್ಟು ಯೋಚನೆ ಮಾಡಿ. ಇನ್ನು ಎಕನಾಮಿ ನೋಡೋದಾದರೆ, ಏನು ಟೊಬ್ಯಾಕೋಯಿಂದ ತುಂಬ ರೆವಿನ್ಯೂ ಬರ್ತದ ನಮಗೆ ಗೌರ್ಮೆಂಟ್ಗೆ ಅನ್ನೋದಾದರೆ ನೋಡೋದಾದರೆ, ನೋಡಿ, ನಮಗೆ ರೆವಿನ್ಯೂ ಬರ್ತಿರೋದು ಸುಮಾರು 8,000 ಕೋಟಿ. ಟೊಬ್ಯಾಕೋ ಮಾರೋದ್ರಿಂದ ಇರ್ಬೋದು ಅಥವಾ ಟ್ಯಾಕ್ಸಸ್ ರೂಪದಲ್ಲಿ ಬರುವುದು 8,000 ಕೋಟಿ. ಆದರೆ ನಾವು ಟೊಬ್ಯಾಕೋ ರಿಲೇಟೆಡ್ ಡಿಸೀಸ್ಗೆ ಖರ್ಚು ಮಾಡ್ತಿರೋದು ವೆಚ್ಚ ಸುಮಾರು 30,000 ಕೋಟಿ ರೂಪಾಯಿ. ಹ್ಯೂಜ್ ಡಿಫ್ರೆನ್ಸ್ ವಿ ಆರ್ ಸೀಯಿಂಗ್. ಇನ್ನು ಇತ್ತೀಚಿನ ದಿನಗಳಲ್ಲಿ ಗ್ಯಾಟ್ ಅಂದರೆ ಗ್ಲೋಬಲ್ ಅಡಲ್ಟ್ ಸರ್ವೆ, ಟೊಬ್ಯಾಕೋ ಸರ್ವೆ ರಿಪೋರ್ಟ್ ಕೊಡ್ತು, ಸ್ಮೋಕಿಂಗ್ ರೆಡ್ಯೂಸ್ ಆಗ್ತಿದೆ ಇನ್ ಇಂಡಿಯಾದಲ್ಲಿ ಅಂತ ಅಂದ್ಬಿಟ್ಟು. ಬಟ್ ಪ್ರತಿ ವರ್ಷ ಕ್ಯಾನ್ಸರ್, ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ ರೋಗದ ಪ್ರಮಾಣ ಹೆಚ್ಚಾಗಿ ಹೋಗ್ತಾನೆ ಇದೆ. 4% ಪುರುಷರಲ್ಲಿ, 4.7% ಪುರುಷರಲ್ಲಿ, 4% ಮಹಿಳೆಯರಲ್ಲಿ ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ ಪ್ರಮಾಣ ಹೆಚ್ಚಾಗ್ತಿದೆ. ಇದಕ್ಕೆ ಮುಖ್ಯ ಕಾರಣ ಪೊಲ್ಯೂಷನ್. ಇದು ನಾವು ಡಿಸಿಷನ್ ತಗೊಳ್ಳೋ ಸಮಯ ಬಂದಿದೆ. ಪೊಲ್ಯೂಷನ್ ಕಂಟ್ರೋಲ್ ಮಾಡೋಕ್ಕೆ ಯಥೇಚ್ಛವಾಗಿ ಪಬ್ಲಿಕ್ ಟ್ರಾನ್ಸ್ಪೋರ್ಟ್ ಬಳಸೋದಿರ್ಬೋದು, ಹಾಗೂ ಈಗ ಗೌರ್ಮೆಂಟ್ ಯಥೇಚ್ಛವಾಗಿ ಒತ್ತು ಕೊಡ್ತಿದೆ ಎಲೆಕ್ಟ್ರಿಕ್ ವೆಹಿಕಲ್ಸ್ಗೆ, ಇದನ್ನು ಅಳವಡಿಸ್ಕೊಡೋದಾಗ್ಬೋದು. ಈ ಮಾರ್ಗದಲ್ಲಿ ನಾವು ಮುಂದೆ ನಡಿಬೇಕಾಗುತ್ತೆ. ಇನ್ನು ರೂಟ್ ಕಾಸ್ ಬಂದ್ಬಿಡೋಣ. ವಾಟ್ ಈಸ್ ದಿ ರೂಟ್ ಕಾಸ್ ಫಾರ್ ಕ್ಯಾನ್ಸರ್? ಅಗ್ರಿಕಲ್ಚರ್. ಬಿಗಿನಿಂಗ್ ಆಫ್ ದಿ 1960s, ಅಂದರೆ 1960ರ ಆಸ್ಪಾಸಲ್ಲಿ ಒಂದು ಗ್ರೀನ್ ರೆವಲ್ಯೂಷನ್ ಕ್ರಾಂತಿ ನಡೀತದೆ 65ರಲ್ಲಿ ಇಂಡಿಯಾದಲ್ಲಿ. ಅಂದರೆ ಫುಡ್ಡು ಬ್ಯಾಲೆನ್ಸ್ ಮಾಡ್ಕೊಳಕ್ಕೆ, ನಾವು ಬೆಳಿತಿರೋ ಆಹಾರ ತುಂಬ ಕೊರತೆ ಆಗಿರ್ತದೆ, ಇದರಿಂದ ಅದನ್ನು ಬ್ಯಾಲೆನ್ಸ್ ಮಾಡೋಕ್ಕೆ ಗ್ರೀನ್ ರೆವಲ್ಯೂಷನ್ ಇದು ಮಾಡ್ತಾರೆ. ಆಗ ಡಿಫ್ರೆಂಟ್ ವೆರೈಟೀಸ್ ಆಫ್ ಅಗ್ರಿಕಲ್ಚರ್ ಕ್ರಾಪ್ಸ್ನ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಮತ್ತು ಕೆಮಿಕಲ್ಸು, ಫರ್ಟಿಲೈಸರ್ಸು, ವೇರಿಯಸ್ ಟು ಇನ್ಕ್ರೀಸ್ ದಿ ಈಲ್ಡ್, ಕ್ರಾಪ್ ಈಲ್ಡ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಇದು ಯಥೇಚ್ಛವಾಗಿ ಪಂಜಾಬ್ ಅಥವಾ ಹರಿಯಾಣ ಇರ್ಬೋದು, ಇವರು ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಇದರ ಫಲಿತಾಂಶ ಈಗಾಗಲೇ ಬಂದಿರೋದ್ರಲ್ಲಿ ಪಂಜಾಬಲ್ಲಿ ಯಥೇಚ್ಛವಾಗಿ ಒನ್ ಆಫ್ ದಿ ಕಾಮನ್ ಕ್ಯಾನ್ಸರ್ ಅಂದರೆ ಈಸೋಫೆಜಿಯಲ್ ಕ್ಯಾನ್ಸರ್, ಅಂದರೆ ಅನ್ನನಾಳದ ಕ್ಯಾನ್ಸರ್ ಯಥೇಚ್ಛವಾಗಿ ಕಂಡುಬರ್ತಿದೆ. ಸುಮಾರು ಸಂಶೋಧನೆಗಳಿಂದ ಆಗಲೇ ದೃಢಪಟ್ಟಿದೆ ಯೂಸ್ ಆಫ್ ಪೆಸ್ಟಿಸೈಡ್ಸು ಅಥವಾ ಪೆಸ್ಟಿಸೈಡ್ಸ್ ಯೂಸ್ ಮಾಡಿರೋ ಆಹಾರದಿಂದ ಕ್ಯಾನ್ಸರ್ ಬರುವ ಸಂಭವ ಅತಿ ಹೆಚ್ಚು ಅಂತ ಅಂದ್ಬಿಟ್ಬಿಡ್ತೀವಿ. ಆದ್ದರಿಂದನೇ ಗಮನಿಸ್ಬೋದು, ಕ್ಯಾನ್ಸರ್ ಎಕ್ಸ್ಪ್ರೆಸ್, ಒಂದು ಟ್ರೈನ್ಗೆ ಕ್ಯಾನ್ಸರ್ ಎಕ್ಸ್ಪ್ರೆಸ್ ಅಂತಲೇ ಹೆಸರಿಕ್ಕಿದ್ದಾರೆ. ಪ್ರತಿನಿತ್ಯ ಬತ್ತಿಂಡಾದಿಂದ ರಾಜಸ್ಥಾನಕ್ಕೆ ಬಿಕನೇರ್ಗೆ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಇದರಲ್ಲಿ ಯಥೇಚ್ಛವಾಗಿ ಮೋರ್ ದೆನ್ 80% ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ ಪ್ರಯಾಣ ಮಾಡ್ತಾರೆ. ಆದ್ದರಿಂದ ಅರ್ಥಕೋಬೇಕು, ನಾವು ಆರ್ಗ್ಯಾನಿಕ್ ಫುಡ್ಸ್ ಯೂಸ್ ಮಾಡೋಕ್ಕೆ ಶುರು ಮಾಡಬೇಕು. ಇನ್ನು ಇಂಜೆಕ್ಟೆಡ್ ವೆಜಿಟೇಬಲ್ಸ್ ಆಗಲಿ ಅಥವಾ ಮೀಟ್ ಆಗಲಿ ಇತ್ತೀಚಿನ ದಿನಗಳಲ್ಲಿ ಯಥೇಚ್ಛವಾಗಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಇದು ಆಲ್ರೆಡಿ ಪ್ರೂವ್ ಆಗಿದೆ, ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಒನ್ ಆಫ್ ದಿ ಮೇನ್ ದಿಸ್ ಒನ್ ಫ್ಯಾಕ್ಟರ್ಸ್. ಆಲ್ರೆಡಿ ಸಮ್ ಸ್ಟಡೀಸ್ ಇಸ್ ಒನ್ ಆಫ್ ದಿ ಪ್ರಾಬಬಲ್ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರ್ ಫಾರ್ ದಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. ಇನ್ನು ಯೋಚನೆ ಮಾಡುವಂಥ ಸಂದರ್ಭ, ವಿಚ್ ಫುಡ್ ವಿ ನೀಡ್ ಟು ಟೇಕ್, ಯಾವ ಫುಡ್ ತಗೋಬೇಕು, ನಮ್ಮ ಆಹಾರ ನಾವು ತಗೊಳ್ಳೋಣ. ಆಲ್ರೆಡಿ ಸೀಸನ್ ವೈಸ್ ಬ್ರೇಕಪ್ಸ್ ಇದೆ, ನಮ್ಮ ಹಿರೀಕರು ಮಾಡಿಕ್ಕಿದ್ದಾರೆ ಸೀಸನ್ ವೈಸ್ ಬ್ರೇಕಪ್ಸ್, ಯಾವ್ಯಾವ ಕಾಲದಲ್ಲಿ ಏನು ತಿನ್ನಬೇಕು ಅಂತ ಅಂದ್ಬಿಟ್ಟು. ವೈ ವಿ ನೀಡ್ ಟು ದಟ್ ಮೀನ್ ಹಾರ್ಮೋನ್ಸ್ ಏನಕ್ಕೆ ಯೂಸ್ ಮಾಡ್ತಾರೆ ಅಂದರೆ ನಿಮ್ಗೆ ಗೊತ್ತಿರ್ಬೋದು, ಸ್ಟ್ರೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋಕ್ಕೆ ಹಾರ್ಮೋನ್ಸ್ ಯೂಸ್ ಮಾಡಿ, ವೆದರ್ ಜಿಬರ್ಲಿನ್ ಇರ್ಬೋದು ಅಥವಾ ಸೈಟೋಕೈನಿನ್ಸ್ ಇರ್ಬೋದು ಯೂಸ್ ಮಾಡ್ತಿದ್ದಾರೆ, ಯಥೇಚ್ಛವಾಗಿ ಯೂಸ್ ಮಾಡ್ತಿದ್ದಾರೆ ಗ್ರೋತ್ ರೆಗ್ಯುಲೇಟರ್ಸ್ ಆಗಿ. ಗೌರ್ಮೆಂಟು ಕೂಡ ತುಂಬ ಒತ್ತು ಕೊಟ್ಟಿದೆ ಇತ್ತೀಚಿನ ದಿನಗಳಲ್ಲಿ ಆರ್ಗ್ಯಾನಿಕ್ ಫಾರ್ಮಿಂಗ್ಗೆ. ಅದೇ ಥರ ನಾವು ಗ್ರಾಹಕರಾದ ನಾವು ಕೂಡ ಆರ್ಗ್ಯಾನಿಕ್ ಫುಡ್ಸ್ನ ಹೆಚ್ಚಾಗಿ ಕೇಳಿದಾಗ ಬೆಳೆಯೋದು ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಇನ್ನು ಜಂಕ್ ಫುಡ್ಸ್ ಮಾತಾಡಲೇಬೇಕು. ರಮೇಶ್ ಸರ್ ಆಗಲೇ ಹೇಳಿದ್ರು, ಒಬೆಸಿಟಿ ಈಸ್ ಒನ್ ಆಫ್ ದಿ ಮೇನ್ ಕಾಸ್ ಫಾರ್ ಕ್ಯಾನ್ಸರ್. ಇತ್ತೀಚಿನ ಸರ್ವೆಗಳ ಪ್ರಕಾರ, ಇಂಡಿಯಾದಲ್ಲಿ ಸರ್ವೆ ಮಾಡಿರೋದ್ರ ಪ್ರಕಾರ 40% ಜನರಲ್ಲಿ ಒಬೆಸಿಟಿ ಇದೆ ಅಂತ. ಅದರಲ್ಲೂ ಸೌತ್ ಈಸ್ ಹ್ಯಾವಿಂಗ್ ಮೋರ್ ಒಬೇಸ್ ಕಂಪೇರ್ಡ್ ಟು ನಾರ್ತ್ ಈಸ್ಟ್ ರೀಜನ್ಸ್, ಆ್ಯಂಡ್ ವುಮೆನ್ಸ್ ಆರ್ ಮೋರ್ ಕಂಪೇರ್ಡ್ ಟು ಮೆನ್ಸ್. ಓಕೆ, ಒಬೆಸಿಟಿ ಡೈರೆಕ್ಟ್ ಕಾಸ್ ಆಗಿರೋದ್ರಿಂದ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಯಥೇಚ್ಛವಾಗಿ ಅಂದರೆ ನಿಯಮಿತ ಎಕ್ಸಸೈಸು ಇದು ಮುಖ್ಯ ಆಗುತ್ತೆ. ಇನ್ನು ಟ್ರೆಂಡ್ ನೋಡೋದಾದರೆ ಪ್ರತಿ ವರ್ಷ ಸುಮಾರು 3% ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರಲ್ಲಿ ಇನ್ಕ್ರೀಸಿಂಗ್ ಟ್ರೆಂಡ್ ಅಬ್ಸರ್ವ್ ಮಾಡ್ತಿದ್ದೀವಿ. ಅದೇ ರೀತಿ ಇನ್ಕ್ರೀಸಿಂಗ್ ಟ್ರೆಂಡ್ ಏನಕ್ಕೆ ಅಂತಂದರೆ ಈ ಮೇಲಿನ ಕಾರಣಗಳು, ಈ ಮೇಲಿನ ರಿಸ್ಕ್ ಫ್ಯಾಕ್ಟರಿಂದ ಪ್ರತಿ ವರ್ಷ 3% ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇನ್ಕ್ರೀಸ್ ಆಗ್ತಿದೆ. ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬೆಂಗಳೂರಲ್ಲಿ ಸೆಕೆಂಡ್ ಹೈಯೆಸ್ಟ್ ಆಫ್ಟರ್ ಚೆನ್ನೈ, ಇದನ್ನು ಗಮನದಲ್ಲಿ ಇಟ್ಕೋಬೇಕು. ಇನ್ನು ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ ನೋಡೋದಾದ್ರೆ ಪ್ರತಿ ವರ್ಷ 1.8% ಡಿಕ್ರೀಸ್ ಆಗ್ತಾ ಬರ್ತಿದೆ. ಇದಕ್ಕೆ ಮುಖ್ಯ ಕಾರಣ ಆಗಿರ್ಬೋದು, ಜೆನೆಟಿಕಲ್ ಹೈಜೀನ್ ಇಂಪ್ರೂವ್ ಆಗಿದೆ ನಮ್ಮದ್ರಲ್ಲಿ, ಅಥವಾ ವ್ಯಾಕ್ಸಿನ್ಸ್ ತಗೊಳ್ಳೋದಿರ್ಬೋದು, ಅಥವಾ ಸೇಫ್ ಸೆಕ್ಸ್ ಆಗಿರ್ಬೋದು. ಇದರಿಂದ ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ ಪ್ರಮಾಣ ಕಮ್ಮಿ ಆಗ್ತಾ ಬರ್ತಿದೆ. ಇನ್ನು ಜನರಲ್ ಕಾಷನ್ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಕರಿತೀವಿ. ವಾಟ್ ಆರ್ ದಿ ಸೈನ್ಸ್, ವಾಟ್ ಆರ್ ದಿ ಕಾಷನ್ಸ್ ಅಂದರೆ ಏನು ವ್ಯತ್ಯಾಸ ಆದರೆ ಡಾಕ್ಟ್ರನ್ನ ಕೂಡಲೇ ಸಂಪರ್ಕಿಸ್ಬೇಕು ಅಂತ ನೋಡೋದಾದರೆ, ಮೊದಲನೇದು ಚೇಂಜ್ ಇನ್ ಬೋವೆಲ್ ಹ್ಯಾಬಿಟ್ಸ್, ಹಾಗೂ ಗಂಟ್ಲಲ್ಲಿ ಇರಿಟೇಷನ್ ಇರೋದು, ಸುಮಾರು ದಿನದಿಂದ ಇರಿಟೇಷನ್ ಇರೋದು, ತೋರಿಸ್ತಲೇ ಹೋಗೋದು, ವಾಯ್ಸ್ ಚೇಂಜ್ ಆಗಿರೋದು. ಈ ಥರ ಏನಾರ 15 ದಿನದಿಂದ ಹೆಚ್ಚು ದಿನ ಏನಾರ ಇದ್ದರೆ ಕೂಡಲೇ ಡಾಕ್ಟ್ರನ್ನ ಸಂಪರ್ಕ ಮಾಡೋಕ್ಕೆ ಪ್ರೇರೇಪಿಸ್ಬೇಕು ನೀವು. ಮತ್ತು ಅನ್ಯೂಶುವಲ್ ಬ್ಲೀಡಿಂಗ್ ಆರ್ ಡಿಸ್ಚಾರ್ಜ್ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಕರಿತೀವಿ. ಐದರ್ ಮೂತ್ರದಲ್ಲಿರ್ಬೋದು, ಯೂರಿನಲ್ಲಿರ್ಬೋದು, ಅಥವಾ ಮಲದಲ್ಲಿರ್ಬೋದು, ಅಥವಾ ಜನನೇಂದ್ರಿಯದಿಂದಾಗಿರ್ಬೋದು. ಅನ್ಯೂಶುವಲ್ ಬ್ಲೀಡಿಂಗ್ ಏನಾರ ಆಗ್ತಿದ್ರೆ ಕೂಡಲೇ ಡಾಕ್ಟ್ರನ್ನ ಸಂಪರ್ಕಿಸ್ಬೇಕು. ಮತ್ತು ದೇಹದ ಯಾವುದೇ ಭಾಗದಲ್ಲಿ ಲಂಪ್ ಅಂತ ಏನು ಕರಿತೀವಿ, ಗೆಡ್ಡೆ ಏನಾರ ಕಾಣಿಸ್ಕೊಂಡ್ರೆ, ಅಥವಾ ಗೆಡ್ಡೆಲಿ ಏನಾರ ಮಾಡಿಫೈ ಆದರೆ, ಗೆಡ್ಡೆ ದಪ್ಪ ಆಗ್ತಿರೋದಾಗಲಿ, ಅಥವಾ ಆಕಾರದಲ್ಲಿ ಏನಾರ ವ್ಯತ್ಯಾಸ ಆದರೆ ಡಾಕ್ಟ್ರನ್ನ ಕಾಣಬೇಕಾಗುತ್ತೆ. ಹಾಗೂ ರಿಪೀಟೆಡ್ ಆಗಿ ಇಂಡೈಜೆಷನ್ ಪ್ರಾಬ್ಲಮ್ ಅಕ್ಕರಾಗೋದು ಇವರು ಕೂಡ. ಹಾಗೂ ಸಪೋಸ್ ನಮ್ಮ ದೇಹದಲ್ಲಿ ಸುಮಾರು ಮಚ್ಚೆಗಳು ಇರ್ತದೆ, ಅದಕ್ಕೆ ಹೆದರಬೇಕಾಗಿಲ್ಲ. ಮಚ್ಚೆಯ ಆಕಾರದಲ್ಲಿ ಏನಾರ ಚೇಂಜ್ ಏನಾರ ಆದರೆ, ಇಲ್ಲಾಂದರೆ ಸೈಜ್ ಏನಾರ ಇನ್ಕ್ರೀಸ್ ಆದರೆ ಕೂಡಲೇ ಇದು ಮಾಡಬೇಕು. ಅಥವಾ ಕೆಲವರಲ್ಲಿ ಗುಣಮುಖವಾಗದ ಕೆಮ್ಮು ಇರ್ತದೆ, ಸುಮಾರು ಒಂದು ತಿಂಗಳು 2 ತಿಂಗಳಾದರೂ ಕೆಮ್ಮು ವಾಸಿ ಆಗ್ತಿರಲ್ಲ, ಸಿರಪ್ ತಗೋತಾರೆ, ಅವಾಗ ಕಮ್ಮಿ ಆಗುತ್ತೆ, ಮತ್ತೆ ರಿಪೀಟ್ ಆಗ್ತಾನೆ ಇರ್ತದೆ. ಅಂಥವರು ಕೂಡ ಕೂಡಲೇ ನಿಮ್ಮ ನಿಯರೆಸ್ಟ್ ಡಾಕ್ಟ್ರನ್ನ ಕಾಣಬೇಕು. ಇನ್ನು ಇಷ್ಟೆಲ್ಲ ಆಯಿತು. ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ, ಕ್ಯಾನ್ಸರ್ನ ಹೇಗೆ ಫೈಟ್ ಮಾಡೋದು ಅಂತ ನೋಡೋದಾದರೆ, ಕ್ಯಾನ್ಸರ್ನ ಯಾಕೆ ಫೈಟ್ ಮಾಡಬೇಕು, ಏನಕ್ಕೆ ಫೈಟ್ ಮಾಡ್ಬೋದು ಅಂತ ನೋಡೋದಾದರೆ ನೋಡಿ, ಇದರಲ್ಲಿ ಸರ್ವೈವಲ್ ಹಾಕಿದ್ದೀನಿ, ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರು ಮತ್ತು ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರು. ಓವರಾಲ್ ಸರ್ವೈವಲ್ ಬಂದ್ಬಿಟ್ಟು ನಮ್ಮ ಇಂಡಿಯಾದಲ್ಲಿ 62% ಇದೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರಲ್ಲಿ, ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರಲ್ಲಿ 66 ಬಂದಿದೆ. ಸ್ಟೇಜ್ 1 ತಗೊಳ್ಳಿ, ವಿಲ್ ಕಾಲ್ ದಿಸ್ ಒನ್ ಆಸ್ ಎ ಅರ್ಲಿ ಡಿಟೆಕ್ಷನ್. ಏನಕ್ಕೆ ಅರ್ಲಿ ಡಿಟೆಕ್ಷನ್ಗೆ ಯಾವಾಗಲೂ ನಾವು ಒತ್ತು ಕೊಡ್ತೀವಿ ಅಂತ ಅಂದರೆ, ಸರ್ವೈವಲ್ ಅಂದರೆ 90% ರೋಗಿಗಳು ಸರ್ವೈವ್ ಆಗ್ತಾರೆ ಅರ್ಲಿ ಡಿಟೆಕ್ಷನ್ ಮಾಡಿದ್ರೆ. ಇನ್ನು ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ ಆದರೆ 83% ಇದೆ. ಇನ್ನು ಸ್ಟೇಜ್ 3, ಸ್ಟೇಜ್ 4 ನೋಡೋದಾದರೆ 57-22% ಇದೆ. ಬಟ್ ದುರದೃಷ್ಟಕರ ಸಂಗತಿ ಏನಂದರೆ, ಈಗಲೂ ನಮ್ಮಂಥ ರೀಜನಲ್ ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ಗೆ ಮೋರ್ ದೆನ್ 50% ದೇ ಆರ್ ಕಮ್ಮಿಂಗ್ ಇನ್ ಸ್ಟೇಜ್ 3 ಆ್ಯಂಡ್ ಸ್ಟೇಜ್ 4. ಇನ್ನೂ ನಾವು ಅಚೀವ್ ಮಾಡೋಕ್ಕಾಗಿಲ್ಲ ಸ್ಟೇಜ್ 1, ಸ್ಟೇಜ್ 2ಲಿ. ಯಾಕಂದರೆ ಸ್ಕ್ರೀನಿಂಗು ನಮ್ಮದು ಸ್ಟ್ರಕ್ಚರ್ಡ್ ಸ್ಕ್ರೀನಿಂಗ್ ಇಲ್ಲ. ಓನ್ಲಿ ಅಪರ್ಚುನಿಟಿಕ್ ಸ್ಕ್ರೀನಿಂಗ್ ವಿ ಆರ್ ನಾಟ್ ಹ್ಯಾವಿಂಗ್ systematic, that means population screening. That is the main cause for that one. And I already told how to prevent. Prevention is always better than cure. ಹೇಗೆ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದು ಅಂದರೆ, ಸ್ಮೋಕ್ ಮಾಡ್ತಿದ್ರೆ ಬಿಟ್ಬಿಡಿ ಸ್ಮೋಕ್ ಮಾಡೋದು, ಇಲ್ಲಾಂದರೆ ಮಾಡ್ತಿಲ್ಲ ಅಂದರೆ ಕಲಿಯೋಕ್ಕೆ ಹೋಗಲೇಬೇಡಿ. ಸಪೋಸ್ 15-20 ವರ್ಷದಿಂದ ಆಗಲೇ ಸ್ಮೋಕ್ ಮಾಡ್ತಿದ್ರೆ, 8-10 ವರ್ಷದಿಂದ, ಆ ಥರ ಟೈಮಲ್ಲಿ ಸೆಲ್ಫ್ ಸ್ಕ್ರೀನಿಂಗ್ ಇಸ್ ದಿ ಬೆಸ್ಟ್ ಮೆಥಡ್. ಹೇಗೆ ಸೆಲ್ಫ್ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡ್ಕೊಳ್ಳೋದು? ಬಾಯಿ, ಸಪೋಸ್ ಓರಲ್ ಕ್ಯಾನ್ಸರ್ ನಾನು ಸ್ಕ್ರೀನ್ ಮಾಡಬೇಕು, ಒಂದು ನಿಲುಗನ್ನಡಿ ಅಥವಾ ಕನ್ನಡಿ ಮುಂದೆ ನಿಂತ್ಕೊಳ್ಳಿ, ಬಾಯಿನ ಮಾಡಬೇಕು. ನಿಮಗೆ, ನಿಮ್ಮ ತಂದೆಯವ್ರಿಗಾಗಲಿ ಯಾರಿಗೇ ಆಗಲಿ, ಬಾಯಿ ಮಾಡಿಬಿಟ್ಟು ಕೆಂಪು ಮಚ್ಚೆ ಅಥವಾ ಬಿಳಿ ಮಚ್ಚೆ ಏನಾದರೂ ಕಾಣಿಸ್ಕೊಂಡಿದೆ ನೋಡ್ಕೊಳ್ಳಿ. ಫಾರ್ ವೈಟ್ ಕಲರ್ ಪ್ಯಾಚಸ್ ವಿ ಆರ್ ಕಾಲಿಂಗ್ ಲ್ಯೂಕೋಪ್ಲಕಿಯಾ, ಅಂದರೆ ಇದು ಕ್ಯಾನ್ಸರ್ ಬಿಗಿನಿಂಗ್ ಹಂತವಾಗಿರ್ತದೆ. ಆ್ಯಂಡ್ ರೆಡ್ ಕಲರ್ ಪ್ಯಾಚಸ್ ಏನಾರ ಇದ್ದರೆ ಎರಿಥ್ರೋಪ್ಲಕಿಯಾ ವಿ ಆರ್ ಕಾಲಿಂಗ್. ಆ್ಯಂಡ್ ಏನಾದರೂ ಗಂಟು ಏನಾರ ಆಗಿದೆಯಾ ನಾಲ್ಗೆಲಿ ಅಥವಾ ಬಾಯಿನ ಅಂಗಳದಲ್ಲಿ ನೋಡ್ಕೋಬೇಕಾಗುತ್ತೆ ಸ್ಮೋಕರ್ಸು. ಇನ್ನು ನಮ್ಮ ವೆಯ್ಟ್ನ ಯಾವಾಗಲೂ ಕಂಟ್ರೋಲಲ್ಲಿ ಇಟ್ಕೊಳ್ಳೋಕ್ಕೆ ಟ್ರೈ ಮಾಡಬೇಕು. ಅದಕ್ಕೆ ಮಾಡ್ರೇಟ್ ಎಕ್ಸಸೈಸ್ ಬಿಡೋಕ್ಕೆ ಹೋಗಬೇಡಿ ಯಾವುದೇ ಕಾರಣಕ್ಕೂ. ವಾಕಿಂಗ್ ಇರ್ಬೋದು, ಜಾಗಿಂಗ್ ಇರ್ಬೋದು, ಅಥವಾ ಜಿಮ್ಗೆ ಹೋಗೋ ಇದ್ದಿದ್ರೆ ಯೋಗ, ಆಮೇಲೆ ಸ್ಟ್ರೆಸ್ನ ಲೀಡ್ ಮಾಡೋಕ್ಕೆ ಧ್ಯಾನ, ಇವೆಲ್ಲ ಇರಬೇಕಾಗುತ್ತೆ. ಇನ್ನು ಡ್ರಿಂಕ್ ಲಿಟ್ಲ್ ಆರ್ ನೋ ಆಲ್ಕೋಹಾಲ್ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಕರಿತೀವಿ. ಆದಷ್ಟು ಕಲೀಲೇಬೇಡಿ, ಕಲಿತ್ರೆ ನಿಯಮಿತ ಇರಲಿ. ಇನ್ನು ಹೆಲ್ತಿ ವೆಜಿಟೇಬಲ್ಸ್, ನಾನು ಆಗಲೇ ಕೇಳಿದೆ, ನಮಗೇನು ಅವೈಲೇಬಿಲಿಟಿ ಇದೆಯೋ ಆ ವೆಜಿಟೇಬಲ್ಸ್ ಯೂಸ್ ಮಾಡಿ. ಹೊಸದೇನು ನಾವು ತಗೊಂಡು ಯೂಸ್ ಮಾಡಬೇಕು ಅಂತ ಇಲ್ಲ. ಐದರ್ ಡೈಲಿ ಆಪಲ್ ಅಂತ ನೀವೇನು ತಿನ್ನಬೇಕು ಅಂತ ಇಲ್ಲ, ಒಂದು ಸೀಬೆಹಣ್ಣು ತಿಂದರೂ ಸಾಕು. ಹೆಚ್ಚು ಫೈಬರ್ ಯುಕ್ತ ಆಹಾರವನ್ನು ಯೂಸ್ ಮಾಡಿ. ಮತ್ತು ಇಂಪಾರ್ಟೆಂಟ್ ಇದು ಅಂತ ಅಂದರೆ, ರೆಗ್ಯುಲರ್ ಆಗಿ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡಿಸ್ಕೋತಿಲ್ಲ, ಆರೋಗ್ಯ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೋತಾ ಇರಿ. ಹಾಗೂ ಕೆಲವಾರು ಆಲ್ರೆಡಿ ರಮೇಶ್ ಸರ್ ಹೇಳಿದ್ರು, ಕೆಲವು ವೈರಸ್ಗಳು ಕಾಸ್ ಇಟ್ ಮೇ ಬಿ ಕಾಸ್ ಫಾರ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಹೇಳಿದ್ರು. ಇದಕ್ಕೆ ಆಲ್ರೆಡಿ ವ್ಯಾಕ್ಸಿನೇಷನ್ಸ್ ಇದೆ. ಹ್ಯೂಮನ್ ಪೆಪಿಲೋಮಾ ವೈರಸ್ ಇದರಲ್ಲಿ 16 and 18 ವೆರೈಟಿ ಅಂತ ಕರಿತೀವಿ. ಇದು ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಕಾಸ್ ಮಾಡುತ್ತೆ. ಇದಕ್ಕೆ ಆಲ್ರೆಡಿ ವ್ಯಾಕ್ಸಿನ್ ಬಂದಿದೆ, ಅದ್ರ ಉಪಯೋಗ ತಗೊಳ್ಳಿ. ಹಾಗೂ ಕ್ಲೀನ್ ಎನ್ವೈರ್ಮೆಂಟ್, ಇಟ್ ಈಸ್ ದಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ನಮ್ಮ ಸರೌಂಡಿಂಗ್ನ ತುಂಬ ಸ್ವಚ್ಛವಾಗಿ ಇಟ್ಕೋಬೇಕು. ಹಾಗೆ ವಿ ಮಸ್ಟ್ ಬಿಕಮ್ ದಿ ಚೇಂಜ್ ದೆನ್ ವಿ ವಾಂಟ್ ಟು ಸಿ. ದಿಸ್ ದಿ ಮೇನ್. ಥ್ಯಾಂಕ್ ಯು. ಸೆಷನ್ ಆಮೇಲೆ.
ಧನ್ಯವಾದಗಳು ಸರ್. ಡಾಕ್ಟರ್ ಶ್ರುತಿ ಶಿವದಾಸ್, ಗರ್ಭಕೋಶ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರು, ಇವರನ್ನು ಕಾರ್ಯಕ್ರಮದ ಕುರಿತಾಗಿ ಮಾತನಾಡಬೇಕೆಂದು ಕೋರಿಕೊಳ್ಳುತ್ತೇನೆ.
Good morning all. Good morning, yeah. So before I start my talk, I would like to thank respected principal and the management of this college, the resting soul of Ms. Bhavani and her family for this opportunity. Thank you, sir. And to the rest of those young people sitting here, hi girls. So this is a term this is a phrase that I commonly use. It gives me some sort of a happiness from inside when I use that term of hey girls, because the moment that I walk into my house, this is the first phrase I use, because I've got 2 girls there. So before I start my talk, let me wish you a very belated Happy Ladies' Day. So as you can see, this is our department in KIDWAI. It is not only a women-centric department, it's also a women-majority department. Most of the doctors are ladies, as you can see. And I would like you to learn this term very well, gynecology. So this is a part of medicine that you are going to go back in again and again in your future. So gynecology is the field of medicine that deals with women-oriented problems alone. Okay? So before I start, I'd also like to say that ನಾನು ಆದಷ್ಟು ಸ್ವಲ್ಪ ಮಧ್ಯದಲ್ಲಾದರೂ I'll try ಕನ್ನಡ ಸ್ವಲ್ಪ ಮಾತಾಡೋಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡ್ತೀನಿ. ಬಟ್ ಅಕಸ್ಮಾತ್ ನನ್ನ ಸೈಡಿಂದ ಏನಾದರೂ ತಪ್ಪು ಬಂದರೆ ದಯವಿಟ್ಟು ಕ್ಷಮಿಸಿ. ಸೊ ಐ ಆಮ್ ಆಸ್ಕಿಂಗ್ ಫಾರ್ ದಿ ಫಾರ್ಗಿವ್ನೆಸ್ ಇನ್ ದ ಬಿಗಿನಿಂಗ್ ಇಟ್ ಸೆಲ್ಫ್. ಐ ಆಮ್ ನಾಟ್ ಅ ಕನ್ನಡಿಗ, ಐ ಆಮ್ ಅ ಮಲಯಾಳಿ, ಬಟ್ ಕನ್ನಡಿಗ ಬೈ ರೆಸಿಡೆನ್ಸ್. ಸೊ ಐ ಆಮ್ ಆಸ್ಕಿಂಗ್ ಯು ಫಾರ್ಗಿವ್ನೆಸ್ ಇನ್ ದ ಬಿಗಿನಿಂಗ್ ಇಟ್ ಸೆಲ್ಫ್. ಸೊ yeah. So before I start my talk, I would like to bring you 2 quotes of an Indian from the past and from the present. So our beloved Gandhiji had once said that woman is the companion of man, gifted with equal mental capacity. So that is something that I want you to remember forever. And from our present, there is Mary Com. Don't let anyone tell you you're weak because you are a woman. And before we go into the talk of taking care of ourselves, this was a famous lady who once said that the history of all times and of today, there is all times till today, especially teaches that women will be forgotten if they forget to think about themselves. So that is very important, especially in India, that women take care of themselves, because most of the time it's nobody else but ourselves who have to think for ourselves. Okay? So I want you to be very careful in listening to this talk, because not just that it has a lot of points which are important to you, ನಿಮ್ಗಾಗ್ಬೋದು, ನಿಮ್ಮ ಸಿಸ್ಟರ್ಸ್ಗಾಗ್ಬೋದು, ನಿಮ್ಮ ತಾಯಿಗಾಗ್ಬೋದು, ನಿಮ್ಮ ಅತ್ತೆಗಾಗ್ಬೋದು, ನಿಮ್ಮ ಸಿಸ್ಟರ್ಸ್ ಇನ್ ಲಾಗೆ ಆಗ್ಬೋದು, ಯಾರಿಗ ಬೇಕಾದರೂ something, there will be something that you carry forward which is important for one of them. Okay? So this is a talk which is going to have, probably going to be censored A in the censor board if you were to compare the rest of the talks, because this has a lot of terms which are going to be used, which would generally be considered taboo. But what I want to stress is that you should not consider these terms as taboo. We should be normalizing these terms in our present life, because all these are very important for us. All right? So is there a yes? Let's go. So this is the female genital tract, which means the internal organs which are particular to the female sex alone. So as you can see, is there a marker in this? That's the red. Okay. Pointer has to come here, right? Yeah. So this is the uterus. ಗರ್ಭಾಶಯ ಕನ್ನಡದಲ್ಲಿ ಹೇಳಕ್ಕಾದ್ರೆ ಗರ್ಭಾಶಯ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಗರ್ಭಾಶಯದಲ್ಲೇ ಪ್ರೆಗ್ನೆನ್ಸಿ ಟೈಮಲ್ಲಿ ಲೇಡಿ ಬಸರಿ ಆಗಿರುವಾಗ ಮಗು ಇಲ್ಲೇ ಇರೋದು. ಬಸರಿ ಅಲ್ಲದೆ ಇರುವ ಲೇಡೀಸು, ನಾನ್ ಪ್ರೆಗ್ನೆಂಟ್ ಲೇಡೀಸ್ಗೆ ಪೀರಿಯಡ್ಸ್ ಇಲ್ಲಿಂದೇ ಬರೋದು. ಸೊ ದಿಸ್ ಇಸ್ ದ ಗರ್ಭಾಶಯ ಅಥವಾ ಯೂಟ್ರಸ್. So this is what we call the cervix. So this is a term which is very commonly used these days because this is a type of cancer where there's a lot of studies going on, where there's a lot of progress. So this is the lower part of the uterus. Kannadadalli helakadre it is called garbhashayadu bayi anta heltivi now. Then these are the ovaries. Ovaries this is the place where we have the eggs coming from, which is needed for reproduction. And this is the vagina, yoni bhaga anta ನಾವು ಹೇಳ್ತೀವಿ, and this is the vulva. So ಮಗು ಹುಟ್ಟುವ ಟೈಮಲ್ಲಿ this is the ಇದು ಮಗು ಬರುವ ದಾರಿನೇ ಇದೆ. ಸೊ ಯೋನಿ ಭಾಗ ಅಂತ ಹೇಳ್ತೀವಿ ಅಥವಾ vagina. So today most of our talk will be concentrated on ovarian cancer. So any of these parts can develop cancer. So if cancer can develop in the ovary, it can develop in the uterus, it can develop in the lower part of the uterus or the cervix, which is called cervical cancer, in the vagina or in the vulva. So I will be just giving few slides regarding ovarian cancer, cervical cancer as well as uterine cancer. So can I get cancer? You have to know that all women of any age group are at risk of developing gynecological cancers. But what is important is that some women are more likely than others to get certain types of gynecological cancers. So in my talk, I will be telling about what are the high risk factors for developing particular type of cancers. But you have to know that cancer which is specific for women can also develop in any age group. Even in young children, some type of cancers can be seen, but not all. So the first I will be dealing with the cervical cancer. Cervical cancer andre garbhashayadu baayinda baro cancer. So cervical cancer, these are the risk factors for cervical cancer. Idu nodide, this is the most important one, which is HPV infection. So what you have to know that unlike other cancers, this one particular cancer is caused by a virus. So most of the other cancers are beyond our control, beyond a point which we can control. But cervical cancer is one cancer which is caused by a virus called the human papilloma virus. So it is just like any other infection, like the coronavirus. So this is a cancer this is a virus which we can catch. But unlike a coronavirus which can be caught by a cold or a cough, the HPV cancer is caught by sexual activity. So that is the mode in which we catch HPV virus in the cervix. So most of the risk factors for cervical cancer is related to sex because that is the mode of catching the HPV virus. So as you can see, if you have multiple sexual partners, then a lady who starts sexual activity very early on, those ladies who have multiple children, especially more than 3 kids. So the thing is, if you start sexual activity very early on, so there's no term which can say that this is particularly early on, but generally we would say before 25 years, if you have started your sexual activity, you are more likely to get cervical cancer. But what is more important is that it is not just about the age of starting of sexual activity, it is also the fact that you have multiple sexual partners. So if you are a person who starts the sexual activity early on, you have multiple sexual partners, then you are more likely to catch cervical cancer. So along with that, just like any virus, the body's immune system, pratirodha shakti anta heltivi kannadadalli. So this immune system is also very important in clearing the virus. So if you have a weak immunity, if you have poor nutrition, you don't eat well, you're very thin, you don't have good nutrition, you are not taking enough immune boosters in your diet, like fruits, vegetables are low, it is a chance that your immune system might be weak. So in that case, you will not be able to clear your HPV virus fast. So what I want you to carry home from this is cervical cancer, this is very important, is related to a virus, which is HPV virus. And this virus is caught from sex. So it doesn't mean that all sex is bad, but most important is that very early sexual activity, especially with multiple sexual partners, is not a good idea in the context of cervical cancer. Then coming to cancer of the ovary, andashayadu cancer. So again here there are multiple risk increasing and reducing factors. So what are more important are, you cannot tell, almost 50% of ovarian cancers are related to family history. So if there are people in the other women in the family having ovarian cancer or uterine cancer or some other cancer in the abdomen, then that person might be at an increased risk of developing ovarian cancer. Then generally ovarian cancer comes from in older women, but that doesn't mean that youngsters will not catch ovarian cancer. There's also a chance, there are some types of ovarian cancers which come in the younger age group. But again, there is no particular factor for it, so I'm not particularly mentioning this in my talk. And a woman who has no children is always more likely to have ovarian cancer and uterine cancer when compared to a woman who has children. And at the same time, you should also note that having children, breastfeeding, using oral contraceptive pills all reduce the incidence of ovarian cancer. So I hope that you know what oral contraceptive pills are. Oral contraceptive pills are those pills that people buy to avoid pregnancy when they are sexually active. Okay. So coming to the cancer of the uterus, garbhashayadu cancer. So ಇಲ್ಲಿ ನೋಡಿದ್ರೆ obesity is a major risk factor for cancers. In the previous talks by Dr. Ramesh sir and Dr. Vijay sir, they have stressed on the importance of obesity. The thing with obesity, that is putting on weight, those women who have more weight will have more body fat. So wherever there is more body fat, there is more of estrogen. Estrogen is a lady hormone. So wherever there is an excess of estrogen, you are more likely to catch some types of cancers which are linked to estrogen. So you have to remember this. So endometrial cancer, uterine cancer is one such cancer which is linked to estrogen. So naturally obesity, people who are more weight are more prone to develop uterine cancer. Then some drugs can increase the risk of cancer. Those women who have a longer menstrual career, what we call by menstrual career is those women who get periods early, like who gets periods early at 10 years, but who have their menopause, that is they continue to menstruate till say 50 or 60 years. They have a long menstrual career when compared to a woman who has her periods at say 13 years and stops menstruating at 40 years, has a very short menstrual career. So those women who have a long menstrual career are generally more prone to develop uterine cancer. Here again, family history also is there. So as you can see, a lot of these cancers are not under our control. If I were to tell the only cancer which is truly, which we can actually manipulate is probably the cervical cancer. So cancer bandre namge ಏನೇನು symptoms ಇರುತ್ತೆ. So cervical cancer, ಗರ್ಭಾಶಯ ಬಾಯಿದು ಕ್ಯಾನ್ಸರ್. So ಅಲ್ಲಾದ್ರೆ ಏನಂದ್ರೆ ಮೇನ್ ಆಗಿ abnormal bleeding ಇರುತ್ತೆ. So what is normal bleeding? Normal bleeding ಅಂದ್ರೆ ಲೇಡಿಗೆ ತಿಂಗಳಲ್ಲಿ ಕರೆಕ್ಟ್ 28 ಡೇಸ್ ಅಲ್ಲಿ ಒಂದ್ಸತಿ ಅಥವಾ 26 ಡೇಸ್ ಅಲ್ಲಿ ಒಂದ್ಸತಿ ಅಥವಾ 30 ಡೇಸ್ ಅಲ್ಲಿ ಒಂದ್ಸತಿ ಅಥವಾ 32 ಡೇಸ್ ಅಲ್ಲಿ ಒಂದ್ಸತಿ ಪೀರಿಯಡ್ಸ್ ಬರುತ್ತೆ. ಆ ಪೀರಿಯಡ್ಸ್ ಯೂಶ್ವಲಿ 3 to 5 ಡೇಸ್ ಇರುತ್ತೆ. ಬ್ಲೀಡಿಂಗ್ ಜಾಸ್ತಿ ಆಗ್ಬೋದು, ಅದು ಇಟ್ ಇಸ್ ಅ ವೆರಿ ಸಬ್ಜೆಕ್ಟಿವ್ ಥಿಂಗ್. ಕೆಲವ್ರಿಗೆ ಜಾಸ್ತಿ ಅಂತ ಅನಿಸ್ಬೋದು, ಕೆಲವ್ರಿಗೆ ಕಮ್ಮಿ ಅಂತ ಅನಿಸ್ಬೋದು, ಬಟ್ ಮೋರ್ ಆರ್ ಲೆಸ್ ಒಂದೇ ಥರ ಎವ್ರಿ ಸೈಕಲ್ ಇಟ್ ಇಸ್ ಹೈ ಆರ್ ಎವ್ರಿ ಸೈಕಲ್ ಇಟ್ ಇಸ್ ಲೋ, ದಟ್ ಇಸ್ ಕಾಲ್ಡ್ ನಾರ್ಮಲ್. ಸೊ ವಾಟ್ ಇಸ್ ಅಬ್ನಾರ್ಮಲ್? ಅಬ್ನಾರ್ಮಲ್ ಅಂದರೆ ಪೀರಿಯಡ್ಸ್ ಟೈಮಲ್ಲಿ ತುಂಬ ಬ್ಲೀಡಿಂಗ್, ಮುಂಚೆ ಇರೋ ಸೈಕಲ್ಸ್ ಅಂತ ನೋಡಿದರೆ ತುಂಬ ಜಾಸ್ತಿ ಬ್ಲೀಡಿಂಗ್ ಹೋಗ್ಬೋದು, ತುಂಬ ಕಮ್ಮಿ ಬ್ಲೀಡಿಂಗ್ ಹೋಗ್ಬೋದು, ಅಥವಾ ಬ್ಲೀಡಿಂಗ್ ಬರದೇ ಇರ್ಬೋದು. 28 ಡೇಸ್ ಬರೋರಿಗೆ 20 ಡೇಸು ಅಥವಾ 15 ಡೇಸಲ್ಲಿ ಒಂದ್ಸತಿ ಬರೋದು. ಪೀರಿಯಡ್ಸ್ ಮಧ್ಯದಲ್ಲಿ ಬ್ಲೀಡಿಂಗ್ ಬರೋದು, ಪೀರಿಯಡ್ಸ್ ಒಂದ್ಸತಿ ಬಂದು ಹೋದ್ಮೇಲೆ ಮತ್ತೆ 5 ಡೇಸ್ ಅಥವಾ 10 ಡೇಸ್ ಬಿಟ್ಟು ಬ್ಲೀಡಿಂಗ್ ಬರೋದು. ಮತ್ತು ಯಜಮಾನ್ರ ಹತ್ರ ಸೇರುವಾಗ ಹಸ್ಬೆಂಡ್ ಹತ್ರ ಸೆಕ್ಷುವಲ್ ಇಂಟರ್ಕೋರ್ಸ್ ಟೈಮಲ್ಲಿ ಬ್ಲೀಡಿಂಗ್ ಬರೋದು. ಆಲ್ ದೀಸ್ ಆರ್ ಕಾಲ್ಡ್ ಅಬ್ನಾರ್ಮಲ್ ವಜೈನಲ್ ಬ್ಲೀಡಿಂಗ್. ಸೊ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರು, ಗರ್ಭಾಶಯದ ಬಾಯಿದು ಕ್ಯಾನ್ಸರು ಮತ್ತು ಗರ್ಭಾಶಯದ ಕ್ಯಾನ್ಸರ್ದು ಎರಡೂ ಮೇನ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇದೇ ಬರುತ್ತೆ. ಬಟ್ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್ ಇಸ್ ಆಲ್ವೇಸ್ ರಿಲೇಟೆಡ್ ಟು ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ. ಸೊ ಸೆಕ್ಸ್ ಟೈಮಲ್ಲಿ ಬ್ಲೀಡಿಂಗ್ ಎಲ್ಲ ಜಾಸ್ತಿ ಬರೋದು, ತುಂಬ ಫೌಲ್ ಸ್ಮೆಲ್ಲಿಂಗ್ ಡಿಸ್ಚಾರ್ಜ್, ಕೆಳಗಡೆಯಿಂದ ಬಿಳಿ ಬಟ್ಟೆ ಕೆಂಪು ಬಟ್ಟೆ ಹೋಗ್ತಾ ಇರೋದು. ದೀಸ್ ಆರ್ ಆಲ್ ಪಾಯಿಂಟರ್ಸ್ ಟುವರ್ಡ್ಸ್ ಪಾಸಿಬಿಲಿಟಿ ಆಫ್ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರ್. ಸೊ ಎಲ್ಲರೂ ಈಗ ಮನೆ ಹೋಗ್ಬಿಟ್ಟು ಯೋಚನೆ ಮಾಡ್ತೀರಾ, ಅಯ್ಯೋ ನನಗೆ ಇದೆಯಾ, ನನ್ನ ಬ್ಲೀಡಿಂಗ್ ಈ ಸತಿ ಜಾಸ್ತಿ ಆಗಿದೆ, ಈ ಸತಿ ಕಮ್ಮಿ ಆಗಿದೆ. ಸೊ ಹಂಗೆ ಏನಾದರೂ ಡಿಫ್ರೆನ್ಸ್ ನಿಮಗೆ ಅನಿಸ್ತಾ ಇದ್ದರೆ ನೀವು ಗೈನಕಾಲಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗ್ಬೋದು. ಸೊ ವಾಟ್ ಈಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಸ್, ಈ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರು ನಾವು ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ ಶುರುವಾದ ತಕ್ಷಣ ಯೂಶ್ವಲಿ ಬರಲ್ಲ. ಇಟ್ ಟೇಕ್ಸ್ ಫ್ರಮ್ ದಿ ಆನ್ಸೆಟ್ ಆಫ್ ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ ಆಲ್ಮೋಸ್ಟ್ 10 to 20 years ಕ್ಯಾನ್ಸರ್ ಬರೋಕ್ಕೆ. But before that, there is a stage called pre-cancer. ಆ ಪ್ರೀ-ಕ್ಯಾನ್ಸರ್ ಸ್ಟೇಜಲ್ಲೂ ಈ ಸಿಂಪ್ಟಮ್ಸ್ ಬರ್ಬೋದು. ಸೊ ನಿಮಗೆ ಏನಾದರೂ ಅಲಾರ್ಮಿಂಗ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇದ್ದರೆ ಖಂಡಿತ ಗೈನಕಾಲಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗಬೇಕು. And cervical cancer coming in a virgin is extremely, there are certain types of cervical cancers which do come in virgins, but they are extremely rare, almost absent. But the ovarian cancer, of this we have to remember, the ovarian cancer is the one which is most likely to get missed. And this is usually the cancer which will come for our mothers, grandmothers, ಮತ್ತೆ ಮದರ್ಸ್ ಇನ್ ಲಾ, ಇವರಿಗೆಲ್ಲ ಜಾಸ್ತಿ ಬರೋದು ಓವೇರಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಸಿಂಪ್ಟಮ್ಸ್ ಏನೇ. ಬಟ್ ದ ಥಿಂಗ್ ಇಸ್ ಇಟ್ ವಿಲ್ ನಾಟ್ ಬಿ ವೆರಿ ಸಿಂಪ್ಟಮ್ಯಾಟಿಕ್, ಇಟ್ ವಿಲ್ ಬಿ ವೆರಿ ವೇಗ್ ಸಿಂಪ್ಟಮ್ಸ್. ನನಗೆ ಊಟ ತಿಂದರೆ ಹೊಟ್ಟೆ ಉಬ್ರತಾ ಇದೆ, ಅಥವಾ ಊಟ ಸ್ವಲ್ಪ ತಿಂದರೆ ತಕ್ಷಣ ಅದು ಅಶ್ವೆ ನಿಂತೋಗುತ್ತೆ. ಅಶ್ವೆ ಬರುತ್ತೆ ಬಟ್ ಅಷ್ಟು ಜಾಸ್ತಿ ತಿನ್ನೋಕ್ಕಾಗಲ್ಲ, ಎಸಿಡಿಟಿ ಜಾಸ್ತಿ ಇದೆ, ಇದೇ ಸಿಂಪ್ಟಮ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ ಆಲ್ ಇಂಡಿಯನ್ ಹೌಸ್ ಹೋಲ್ಡಲ್ಲಿ ಎಲ್ಲರೂ ಹೇಳ್ತಾ ಇರ್ತಾರೆ, ಬಿಕಾಸ್ ವಿ ಹ್ಯಾವ್ ಸ್ಪೈಸಿ ಫುಡ್. ಸೊ ಬಿಕಾಸ್ ಆಫ್ ದ್ಯಾಟ್ ದಿಸ್ ಇಸ್ ಅ ಕಾಮನ್ ಸಿಂಪ್ಟಮ್ ಆಫ್ ಮೆನ್ ಆ್ಯಂಡ್ ವಿಮೆನ್. Immaterial. So, but the thing is, we should be careful. If a lady complains of these constant symptoms almost every day for 2 weeks or more, you have to think of the possibility of ovarian cancer. In that case, it is best to get the lady checked up by a gynecologist. So, what can we do? So, as I said, symptoms alla ನಾವು ಹೇಳಿದ್ವಿ. ನಿಮಗೆ ಏನಾದರೂ ಸಿಂಪ್ಟಮ್ಸ್ ಡಿಫ್ರೆಂಟ್ ಆಗಿ ಅಬ್ನಾರ್ಮಲ್ ಆಗಿ ಏನಾದರೂ ಸಿಂಪ್ಟಮ್ಸ್ ಇದೆ, ತಕ್ಷಣ ಗೈನಕಾಲಜಿಸ್ಟ್ ಹತ್ರ ಚೆಕಪ್ಗೆ ಹೋಗಬೇಕು. So cervical cancer, as I've already told, it is because of a virus. So a virus infection ನಮಗೆ ಬಂದಿದೆಯಾ ಅಂತ ನೋಡೋಕೆ ನಾವು ಬ್ಲಡ್ಡಲ್ಲಿ ಡೆಂಗು ಬಂದಿದೆಯಾ ಅಂತ ಬ್ಲಡ್ ಚೆಕಪ್ ಮಾಡ್ತೀವಿ, ಟೆಸ್ಟ್ ಮಾಡೋಕ್ಕೆ ಬ್ಲಡ್ ಚೆಕಪ್ ಮಾಡ್ತೀವಿ. ಕೊರೋನಾ ಬಂದಿದೆಯಾ ಅಂತ ನೋಡೋಕ್ಕೆ ನೇಸಲ್ ಸ್ವ್ಯಾಬ್ ತಗೊಳ್ತೀವಿ. ಅದೇ ಥರ HPV ಇನ್ಫೆಕ್ಷನ್ ಸರ್ವಿಕ್ಸಲ್ಲಿ ಬಂದಿದೆಯಾ ಅಂತ ನೋಡೋಕ್ಕೆ ಪ್ಯಾಪ್ ಸ್ಮಿಯರ್ ಅಂತ, ನೇಸಲ್ ಸ್ವ್ಯಾಬ್ ಥರ ಪ್ಯಾಪ್ ಸ್ಮಿಯರ್ ಅಂತ ಸರ್ವಿಕ್ಸಿಂದ ತೆಗೆದು ಟೆಸ್ಟ್ ಮಾಡ್ಬೋದು. ಸೊ ದಟ್ ಈಸ್ ಒನ್ ಟೆಸ್ಟ್ ದಟ್ ಇಟ್ ಕ್ಯಾನ್ ಬಿ ಡನ್. ಐ ವಿಲ್ ಟೆಲ್ ಅಬೌಟ್ ಇಟ್ ಫರ್ದರ್. Then HPV vaccine anta, because it is a virus, just like for corona ನಾವು ಕೋವಿಡ್ ವ್ಯಾಕ್ಸಿನ್ ತಗೊಳ್ತೀವಿ, ಅದೇ ಥರ HPV virus ಬರದೇ ಇರೋದಕ್ಕೆ HPV ವ್ಯಾಕ್ಸಿನ್ ಅಂತಾನೂ ಸಿಗುತ್ತೆ. ಸೊ ಐ ವಿಲ್ ಬಿ ಸ್ಟ್ರೆಸ್ಸಿಂಗ್ ಅಬೌಟ್ ದಟ್ ವ್ಯಾಕ್ಸಿನ್ ಲೇಟರ್. ಮತ್ತು ಎಂಡೋಮೆಟ್ರಿಯಲ್ ಯೂಟ್ರೈನ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಮೇನ್ ಆಗಿ ಇಟ್ ಇಸ್ ಮೇನ್ಲಿ ಸಿಂಪ್ಟಮ್ ಬೇಸ್ಡ್, ಎಸ್ಪೆಷಲಿ ಒಂದು ಲೇಡಿ, ಇಫ್ ಎ ಲೇಡಿ ಈಸ್ ವೆರಿ ಆನ್ ದ ಪ್ಲಂಪರ್ ಸೈಡ್, ಶಿ ಹ್ಯಾಸ್ ನೋ ಚಿಲ್ಡ್ರನ್, ಶಿ ಈಸ್ ಡಯಾಬೆಟಿಕ್, ಶುಗರ್ ಕಾಯಿಲೆ ಇದೆ, BP ಕಾಯಿಲೆ ಇದೆ, ಇದೆಲ್ಲ ಇದೆ, ಪೇಷಂಟ್ಗೆ ಅಬ್ನಾರ್ಮಲ್ ಬ್ಲೀಡಿಂಗ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇದೆ, ಶಿ ಈಸ್ ದಿ ಕರೆಕ್ಟ್ ಪೇಷಂಟ್ ಹೂ ಇಸ್ ಲೈಕ್ಲಿ ಟು ಹ್ಯಾವ್ ಯೂಟ್ರೈನ್ ಕ್ಯಾನ್ಸರ್. ಸೊ ಯು ಹ್ಯಾವ್ ಟು ಬಿ ವೆರಿ ವೆಜೈಲ್. ಸಿಂಪ್ಟಮ್ಸ್ ಬಂದರೆ ತಕ್ಷಣ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಬೇಕು. ಮತ್ತು ಮುಟ್ಟು ನಿಂತಾದ ಮೇಲೆ ಮತ್ತು ಪೀರಿಯಡ್ಸ್, ಇಫ್ ಪೇಷಂಟ್ ಇಸ್ ಪರ್ಸನ್ ಇಸ್ ಆಲ್ರೆಡಿ ಹ್ಯಾಡ್ ಮೆನೋಪಾಸ್, ಆಮೇಲೆ ಮತ್ತೆ ಬ್ಲೀಡಿಂಗ್ ಬರೋದು, ದಟ್ ಈಸ್ ಆಲ್ಸೋ ಅನದರ್ ಸಿಂಪ್ಟಮ್ ಆಫ್ uterine cancer. So this is also a symptom that you should watch for your parents, your grandparents. You should be vigilant. Okay. Then ovarian cancer, as I said, very highly non-specific symptoms irutte, blotting sensation, acidity symptoms, adene main barodu. So consistent agi ನಿಮ್ಮ ತಾಯಿ ಅಥವಾ grandmother, auntie ಯಾರಾದರೂ ಈ ಥರ symptoms consistently ಹೇಳ್ತಾ ಇರ್ತಾರೆ, you should consider the possibility of an ovarian cancer. ಚೆಕಪ್ಗೆ ಹೋಗಬೇಕು. ಮತ್ತು another important one, breast cancer. Breast cancer ಅಂದರೆ ಸ್ತನಗಳದ್ದು ಕ್ಯಾನ್ಸರು. ಸೊ ಸ್ತನಗಳದ್ದು ಕ್ಯಾನ್ಸರ್ ಬರೋದಕ್ಕೆ ಮೇನ್ ಆಗಿ ಯು ಶುಡ್ ಆಲ್ವೇಸ್ keep checking yourself. Your own breast should be examined every month. That I will be just giving a short some pics on how the breast self examination is to be done. And there is a scan called a mammogram which has to be done annually after you are 30 years of age, or ideally 40 years. 30 years mele it is little difficult to pick up. So at above 40 years all women should undergo annual mammogram. So as I said, I'll be mainly stressing on cervical cancer. Cervical cancer, HPV virus related. So just like the corona swab picks up, nasal swab picks up coronavirus, we have a cervical swab which picks up the HPV virus. So that is called the pap smear. ಮುಂಚೆ ಹೇಳಿದಂಗೆ the virus is transmitted by sex. So once you are sexually active, 3 years from your sexual debut, so that is a term that we like to use, just like your dance debut, your musical debut, your college debut. It's a term that we doctors use, which is called sexual debut, which means onset of sexual activity. So once you are sexually active, so once you are sexually active, 3 years from your onset of your sexual activity, that is from your debut, every lady should go for a pap smear. So this is just like a nasal swab for coronavirus. This is a cervical swab for HPV virus. So that's what it's called, the pap test. So a pap test alli, they will just see if there is any cancer or if there are any changes which are which occur before cancer called the pre-cancer, and they will also check for the HPV virus. So this is very important test. You should encourage all your fellows or your friends who are sexually active to go for the pap smear, or at least to get a gynecological opinion. So in India, generally women have this ontara taboo irutte. Gynecologist hatra hogoda, kelagade check marsuda. Everybody is generally very reluctant. As a matter of fact, the truth is that even doctors are reluctant to go for other gynecologists for their checkup, because we have generally a taboo associated with such an examination. So this is how the blade is. So I just want you to relax on the methods, because I hear that most of you are married here. So this is how a lady will be lying during the examination. It's a very simple procedure, and this particular speculum will be inserted. And just like the corona nasal swab, a swab is put into the cervix. So this is the uterus, and this is the cervix, and a smear will be taken. This is the pap test. It is not a very painful examination at all. More than the physical pain, it is actually the psychological pain. Most of us are associated with going to the gynecologist and going for an examination. It's a very simple test which hardly takes 1 minute, but it saves you for it gives you an additional 20 to 30 years of your life. So it's very important that you go for the test once you are sexually active. So the other thing that I would like to stress is on the HPV vaccine. So as I have said, just like the coronavirus has the corona vaccine, the HPV virus has the HPV vaccine. So I want you to remember this slide. So all mothers, daughters, everybody should remember this particular slide. So I have not put any write-up in this slide because I want you to remember these pictures. So this is a vaccine which is ideally to be taken sexual activity shuru agak munchene, because namge virus barode prevent madbeku antidre virus baro chance yavag barutte. When do you start? When do you catch the virus? How do you catch the virus? I want to hear that loud. How do you catch the virus? During? Yeah, tell it loud. Yes. So during sexual activity is when you catch the virus. So when should we take the vaccine? Before your sexual, what's the term I said? Sexual debut. So before your sexual debut, you should take the vaccine ideally. This is the ideal setup. So usually assuming that most people will start their sexual debut by say 20 to 23 years, the vaccine should ideally be given, and the child is when the girl is in the adolescence. So 9 to 15 years is when we can start giving the vaccine to the girl. If you are past your 15 years also, you can take it. Ideally, you should take the vaccine before you start your sexual activity. So ideally, vaccine sexual activity shuru madak munchene tagondirbeku, but sexual activity shuru madidru kuda vaccine tagobodu. Vaccine tagobeku antidre nanu helidiyalla HPV idiya anta. Coronavirus iruvaga swab vaccine kodtara illa. Coronavirus active infection idre vaccine kodalla. ಅದೇ ಥರ HPV virus active infection ಇದೆಯಾ ಅಂತ ಕೊರೋನಾ ಸ್ವ್ಯಾಬ್ ಥರ HPV ಸ್ವ್ಯಾಬ್ ಪ್ಯಾಪ್ ಸ್ಮಿಯರ್ ತಗೋಬೇಕು. ಪ್ಯಾಪ್ ಸ್ಮಿಯರಲ್ಲಿ HPV ಇನ್ಫೆಕ್ಷನ್ ಇಲ್ಲ ಅಂತಿದ್ರೆ HPV ವ್ಯಾಕ್ಸಿನ್ ತಗೋಬೋದು. ಸೆಕ್ಷುಲಿ ಆಕ್ಟಿವ್ ಇದ್ರೂ ಕೂಡ HPV ವ್ಯಾಕ್ಸಿನ್ ತಗೋಬೋದು if your HPV test is negative. So this is very important. You have to remember this vaccine, and I advise that all of you go ahead with the vaccine even if you are sexually active. You go for a gynecologist, get your HPV test done. If your HPV test is negative, you can safely take the vaccine. You have to remember that this vaccine is almost 70% to 90% prevents cervical cancer. So this is very important. You are having a cancer which is truly preventable. ಎಷ್ಟೊಂದು ಕ್ಯಾನ್ಸರ್ಗಳು ನಮ್ಮ ಕೈಯಲ್ಲಿ ಇರಲ್ಲ. ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ನಮಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ನಮ್ಮ ಈಸ್ಟ್ರೋಜನ್ ನಮ್ಮ ಬಾಡಿ ಹೆಂಗೆ ಬಿಹೇವ್ ಮಾಡುತ್ತೆ ಅಂತ ನಮಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಬಟ್ ಸರ್ವೈಕಲ್ ಕ್ಯಾನ್ಸರು ಪ್ರಿವೆಂಟ್ ಮಾಡೋದು ಇಸ್ ಮೋರ್ ಆರ್ ಲೆಸ್ ಇನ್ ಅವರ್ ಹ್ಯಾಂಡ್ಸ್. You are controlling your sexual activity, onset of your sexual debut, age delay ಮಾಡಬಹುದು. Once you are sexually active, stick to one partner, very important. Always have good healthy diet, maintain your immunity, very important. Take the HPV vaccine, very important. Once you are sexually active, you should go for pap smear, HPV testing. All these are very important. These are all taboo subjects, but these are all very important so that you are getting around 20 to 30 years extra in your life by doing all this. So it's very important that you go for it. So you have to remember that, so if the female is getting, what about the male? The male also can get the HPV virus. So HPV will not differentiate, oh you are a female, so I will catch only you, I will not catch the male. Anta differentiate ಮಾಡಲ್ಲ HPV. Female ಗೆ ಬಂದ್ರೆ HPV male ಗುರು ಬರಬಹುದು. ಬಟ್ ಇಷ್ಟು ದಿನ ಈ ಎರಡು ವ್ಯಾಕ್ಸಿನ್ ನಾನು ಮುಂಚೆ ತೋರಿಸಿರೋ ಎರಡು ವ್ಯಾಕ್ಸಿನ್, ದಟ್ ಇಸ್ ಸರ್ವರಿಕ್ಸು ಗಾರ್ಡಸೆಲ್, ಇದೇನೇ ಮೇನ್ ವ್ಯಾಕ್ಸಿನ್ಸು. ಇದೆರಡೂ ಮೇನ್ಲಿ ಫಾರ್ ಫೀಮೇಲ್ಸ್ ಇತ್ತು. But now currently Gardasil 9 anta hosa vaccine bandide, which is a gender neutral HPV vaccine. India is gender neutral, so you can give it to both males and females, ideally starting from 9 years of age. 15 years ಮುಂಚೆ 2 doses ಇರುತ್ತೆ, 16 years ಆದಮೇಲೆ 3 doses ಇರುತ್ತೆ. ಕರೆಂಟ್ಲಿ ಈಗ ಸ್ಟಡೀಸು ಇದೆ, ಸಿಂಗಲ್ ಡೋಸ್ ತಗೊಂಡ್ರೂ ಕೂಡ ತುಂಬ ಪ್ರೊಟೆಕ್ಷನ್ ಸಿಗುತ್ತೆ ಅಂತ WHO ಒಂದು ವರ್ಲ್ಡ್ ಹೆಲ್ತ್ ಆರ್ಗನೈಸೇಷನ್ ಒಂದು ಸ್ಟಡಿ ಇದೆ. ಸೊ ಹಾಗಾಗಿ ಐ ವುಡ್ ಅಡ್ವೈಸ್ ಯು ಟು ಅಟ್ ಲೀಸ್ಟ್ ಗೋ ಫಾರ್ ಅ ಸಿಂಗಲ್ ಡೋಸ್ ಆಫ್ ದ ವ್ಯಾಕ್ಸಿನ್. The cheapest vaccine will cost around 2,500 per dose, but it is worth. So at least go for a single dose of the vaccine. So very important. This is one thing I want you all to take home and tell your mothers or your sisters or your aunties, anybody. You have to take this home and tell them today. You should not forget this. This is very important, not just for you. Even if you are reluctant, it might help a lot of other ladies around you. So you have to take this forward. I want you to remember the HPV vaccine and the pap smear. Which are the two things? HPV vaccine and pap smear. So these two things you have to carry them home, okay? Without fail. So again, these are all Western, non-Indian foreign vaccines. So to make vaccines more available, we have Poonawalla. So who's Poonawalla? Yeah, he's the CEO of the Serum Institute of India. So they were very much in the news when the vaccines came, the COVID vaccines. So he has told in his Twitter a few months back, he had put that they are also in the effort, in Indian cervical HPV vaccines are also in the pipeline. So as I've already mentioned, very important that modified cervical cancer is highly preventable. Delay your sexual debut. Once you are sexually active, stick to one partner. Sexual activity ಲೇಟ್ ಆಗಿ ಶುರು ಮಾಡಬೇಕು, 25 years ತನಕ ಆದಷ್ಟು ಡಿಲೇ ಮಾಡಬೇಕು. ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ ಶುರು ಆದ ತಕ್ಷಣ ಯು ಹ್ಯಾವ್ ಟು ಒಂದೇ ಪಾರ್ಟ್ನರ್, ಯು ಶುಡ್ ಸ್ಟಿಕ್ ಟು ಸಿಂಗಲ್ ಪಾರ್ಟ್ನರ್. ಆ್ಯಂಡ್ ಒನ್ಸ್ ಬಿಫೋರ್ ಯು ಸ್ಟಾರ್ಟ್ ಯುವರ್ ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ HPV ವ್ಯಾಕ್ಸಿನ್ ತಗೋಬೇಕು. ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ ಶುರು ಆದಮೇಲೆ ರೆಗ್ಯುಲರ್ ಪ್ಯಾಪ್ ಸ್ಮಿಯರ್ ಸ್ಕ್ರೀನಿಂಗ್ಗೆ ಹೋಗಬೇಕು. ಒನ್ಸ್ ಇನ್ 3 years, 3 ವರ್ಷಕ್ಕೊಂದ್ಸತಿ ಪ್ಯಾಪ್ ಸ್ಮಿಯರ್ ಸ್ಕ್ರೀನಿಂಗ್ಗೆ ಹೋಗಬೇಕು. ಆ್ಯಂಡ್ ಸೆಕ್ಷುವಲ್ ಆಕ್ಟಿವಿಟಿ ಶುರು ಆದರೂ ಕೂಡ HPV ವ್ಯಾಕ್ಸಿನ್ಗೆ ಇನ್ನೂ ಸಾಧ್ಯತೆ ಇದೆ. HPV ಟೆಸ್ಟ್ ನೆಗೆಟಿವ್ ಇದ್ದರೆ ವ್ಯಾಕ್ಸಿನ್ ತಗೋಬೋದು. ಆ್ಯಂಡ್ ಯು ಆರ್ ಗೆಟಿಂಗ್ ಅಡಿಷನಲ್ 20 to 30 years ವಿತ್ ಆಲ್ ದಿಸ್. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. So that is mainly about the gynecological cancers. Before I stop my very boring talk, I'm sure all of you are asleep, but I just want to stress on one more cancer which is not really dealt with our gynecology department. This usually comes under surgical departments if you go to any hospital. So this is cancer of the breast. Breast andre stana. So stanagaladu cancer, breast. So breast cancer is one of the commonest cancer among women in India. It is the commonest cancer among women in India, breast cancer. Cervical cancer comes below that. So if the most common cancer andre breast cancer ene. So breast cancer is again prevent ಮಾಡಕ್ಕೆ ನಮಗೆ ಆಗಲ್ಲ. So what's more important is that you pick it up early. Just like Vijay sir had previously explained in his slides, cancer it is not, if cancer late stage ಅಲ್ಲಿ ನಿಮಗೆ ಕಂಡು ಹಿಡಿದ್ರೆ, ಕ್ಯಾನ್ಸರ್ ಸಿಂಪ್ಟಮ್ಸ್ ಶುರು ಆದಮೇಲೆ ನಾವು ಕಂಡು ಹಿಡಿದ್ರೆ ಅದು ಸರ್ವೈವಲ್, ಅದು ಕ್ಯಾನ್ಸರ್ ಕಂಡು ಹಿಡಿದ ಮೇಲೆ ಸರ್ವೈವಲ್ ಕಮ್ಮಿ ಇರುತ್ತೆ, ಅಷ್ಟು ವರ್ಷ ಇರಲ್ಲ, ಮಾಮೂಲಿ ಜನ ಥರ ತನಕ ಅಷ್ಟು ವರ್ಷ ಇರಲ್ಲ. ಬಟ್ ಕ್ಯಾನ್ಸರ್ early ಸ್ಟೇಜಲ್ಲೇ ಕಂಡು ಹಿಡಿದ್ರೆ you can live your life almost like a normal person. You will have as many years to live in your life. So it's very important that you pick up cancers in your early stage. So in breast cancer, there is no vaccine available, but what is more important is something which you can easily palpate. Now with your hand, you can palpate and pick this lump very early on. So it's very important that you do a breast self-examination every month. It has to be done after your periods ಬಂದು ಹೋದ್ಮೇಲೆ ಒಂದು 3-4 days ಬಿಟ್ಟು, ಅಥವಾ ಪೀರಿಯಡ್ಸ್ ಶುರು ಆಗಿ ಒಂದು 10th day ನಲ್ಲಿ ಪ್ರತಿ ತಿಂಗಳಲ್ಲೂ ಒಂದು ಸತಿ ಆದರೂ ಯು ಶುಡ್ ಚೆಕ್ಅಪ್ ಯುವರ್ ಬ್ರೆಸ್ಟ್ ಚೆಕ್ಅಪ್ ಮಾಡುವಾಗ ದಿಸ್ ಆರ್ ದ ಪೊಸಿಷನ್ಸ್. ಐದರ್ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಪೊಸಿಷನಲ್ಲಿ ಚೆಕ್ ಮಾಡ್ಬೋದು ಅಥವಾ ಲೈಯಿಂಗ್ ಡೌನ್ ಪೊಸಿಷನಲ್ಲಿ ಚೆಕ್ ಮಾಡ್ಬೋದು. ಯಾವ ಕಡೆದು ಬ್ರೆಸ್ಟ್ ಎಕ್ಸಾಮಿನ್ ಮಾಡ್ತೀವೋ ಆ ಕಡೆದು ಕೈ ಮೇಲೆ ಇಟ್ಕೊಂಡು ಎಕ್ಸಾಮಿನ್ ಮಾಡಬೇಕಾಗುತ್ತೆ, ಆಪೋಸಿಟ್ ಕೈಯಲ್ಲಿ ಎಕ್ಸಾಮಿನ್ ಮಾಡಬೇಕಾಗುತ್ತೆ. ಸೊ ಅದು ಯಾವ ರೀತಿನಲ್ಲ ಅಂದರೆ ಕೈದು the palmar portion of your fingers, ee bhagadalli examine ಮಾಡಬೇಕು. This is what you should be using, not the entire hand. So you should use the palmar portion of your fingers. So these are the different ways. Either you can examine from the nipple, itara circular agi ಹಿಂಗೆ examine ಮಾಡ್ಕೊಂಡು ಓಡ್ಕೊಂಡು, so that ಇದು ಏನಕ್ಕೆ ಅಂದರೆ ಇದೆಲ್ಲ ಇಟ್ಟಿರೋದು ಏನಕ್ಕೆ, so that it can be anywhere in the breast, you can miss it, so that entire breast is covered by your examination ಅಂತ ಈ 3 ಟೆಕ್ನಿಕ್ಸ್ ಇಟ್ಟಿರೋದು. So ಇದರಲ್ಲಿ you start from the nipple and you go in circular motion slowly. This is the way you should move your hands. So first you keep your hand here, then you keep your hand here, you go around like the circular from inside out, periphery, center in the periphery tanka hogbodu. So this is how you are holding your hand. So nodi fingers to palmar portions in the examine ಮಾಡ್ತಾ ಇದ್ವಿ, not this part of the palm, the palmar portion of your fingers. Then this is another way where you start from the nipple and just go outside in spokes ತರ, wheels ಬರುತ್ತಲ್ಲ ಕಾರ್ದು ಸೈಕಲ್ದೆಲ್ಲ wheels ತರ spokes ತರ ಹಿಂಗಿಂಗ್ ಮಾಡ್ತೀವಿ ನೋಡಬೇಕು, from center to periphery. The other way is just like a game, ಈ games ಎಲ್ಲ ಬರುತ್ತಲ್ಲ those where you move like this and you put the beads. So ಆ ತರ you start from one end, you go down, up, hairpin loops ತರ ಮಾಡಬೇಕು. So these are the 3 examinations we can examine. You have to examine every month the same day after your periods have stopped. So around the 10th day or from the start of your periods, you can safely examine. Both breasts have to be examined, either lying down or standing position with the same side hand should be kept up. ಕೈ ಮೇಲೆ ಇಟ್ಕೊಂಡು ಆ ಸೈಡು ಬ್ರೆಸ್ಟ್ ಎಕ್ಸಾಮಿನ್ ಮಾಡಬೇಕು. ಇದರಲ್ಲಿ ಯಾವುದಾದ್ರೂ ಒಂದು ರೀತಿಯಲ್ಲಿ ಪ್ರತಿ ತಿಂಗಳು ಒಂದಿನ ಪೀರಿಯಡ್ಸ್ ಮುಗ್ದಾದ್ಮೇಲೆ, ಸೊ ಅರೌಂಡ್ 10th ಡೇ ಪೀರಿಯಡ್ಸ್ ಶುರುವಾಗಿ 10th ಡೇ ಹತ್ರ ಫಿಕ್ಸ್ ಮಾಡಿಕೊಂಡು ಎಕ್ಸಾಮಿನ್ ಮಾಡ್ಬೋದು. ಏನಾದರೂ ನಿಮಗೆ ಲಂಪ್ಸ್ ಥರ ಅನಿಸಿದ್ರೆ ಖಂಡಿತ ಸರ್ಜನ್ ಅಥವಾ ಗೈನಕಾಲಜಿಸ್ಟ್ ಹತ್ರ ಹೋಗಬೇಕು. So other than that, mammogram and the breast scans ಇದೆ. So once you're 40 years and above, so your mothers or your aunties should go for mammogram at least once a year. But once a year might not be very feasible. At least once in 3 years is what I would practically tell. Nam medical guidelines alla nodidre it is annual up to 55 years. But at least once in 3 to 4 years in a lifetime, at least once in a lifetime on mammogram anta ನಾವು ಹೋಗಬೇಕಾಗುತ್ತೆ. So before I stop my talk, again I would like to remember all the ladies here. That you are a woman and that is your superpower, and all the older ladies, you are wild ones, so don't let them tame you, and be a strong woman so that your daughter, it's very important, this is something I find very important, so I have a son also, be a strong woman so your daughter will have a role model and your son will know what to look for in a woman when he is a man. I think this is more important than anything else. More than teaching your daughters, I feel it's more important teaching your sons. All right, so that's all. I hope you understood the gist of my talk. If you have any doubts, you can please ask. Thank you.
ಧನ್ಯವಾದಗಳು ಮ್ಯಾಮ್. ಈಗ ಅನುಪಮಾ ಆರ್ ರವರಿಂದ ವಂದನಾರ್ಪಣೆಗಳು.
ನಮಸ್ಕಾರ. ಮೊದಲಿಗೆ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಆಯೋಜಿಸಲು ಸಲಹೆ ಮತ್ತು ಸಹಕಾರ ನೀಡಿದ ರಾಷ್ಟ್ರೀಯ ಶಿಕ್ಷಣ ಸಮಿತಿ ಟ್ರಸ್ಟ್ ಹಾಗೂ ಪ್ರಾಂಶುಪಾಲರಾದ ಡಾಕ್ಟರ್ ಸ್ನೇಹಾಲತಾ ಜಿ ನಾಡಿಗರ್ ಮತ್ತು ಉಪಪ್ರಾಂಶುಪಾಲರಾದ ಡಾಕ್ಟರ್ ವಸಂತವಲ್ಲಿ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮ ಆಯೋಜನೆಯಲ್ಲಿ ತಮ್ಮ ಸಹಕಾರ ನೀಡಿದ ಕಿದ್ವೈ ಸ್ಮಾರಕ ಗಂತಿ ಸಂಸ್ಥೆಯ ನಿರ್ದೇಶಕರಾದ ಡಾಕ್ಟರ್ ಸಿ ರಾಮಚಂದ್ರ ಅವರಿಗೆ ಮತ್ತು ಈ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿ ತಮ್ಮ ಜ್ಞಾನವನ್ನು ಹಂಚಿಕೊಂಡ ತಜ್ಞ ವೈದ್ಯರಾದ ಡಾಕ್ಟರ್ ಸಿ ರಮೇಶ್ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳು. ಡಾಕ್ಟರ್ ವಿಜಯ್ ಸಹ ಪ್ರಾಧ್ಯಾಪಕರು, ಡಾಕ್ಟರ್ ಶ್ರುತಿ ಶಿವದಾಸ್ ಗರ್ಭಕೋಶ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರು, ಡಾಕ್ಟರ್ ಅವಿನಾಶ್ ಹಿರಿಯ ವೈದ್ಯಾಧಿಕಾರಿಗಳು, ಮತ್ತು ತಂತ್ರಜ್ಞರಿಗೂ ಕಾಲೇಜಿನ ಹಾಗೂ ಜೈವಿಕ ತಂತ್ರಜ್ಞಾನ ವಿಭಾಗದ ಪರವಾಗಿ ತುಂಬು ಹೃದಯದ ವಂದನೆಗಳನ್ನು ಸಮರ್ಪಿಸುತ್ತೇವೆ. ತಮ್ಮ ದುಃಖದ ಸಮಯದಲ್ಲಿಯೂ ಇತರರ ಒಳಿತಿಗಾಗಿ ಯೋಚಿಸಿ ಪ್ರತಿ ವರ್ಷ ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಯಾವುದೇ ಕುಂದುಕೊರತೆ ಇಲ್ಲದಂತೆ ಆಯೋಜಿಸಲು ಕಾರಣಭೂತರಾದ ಶ್ರೀಮತಿ ಭವಾನಿ ಅವರ ತಂದೆಯವರಾದ ಡಾಕ್ಟರ್ ತುಳಜಪ್ಪ ಮತ್ತು ಇತರ ದಾನಿಗಳಿಗೆ ಕಾಲೇಜು ಹಾಗೂ ಜೈವಿಕ ತಂತ್ರಜ್ಞಾನ ವಿಭಾಗದ ಪರವಾಗಿ ತುಂಬು ಹೃದಯದ ಕೃತಜ್ಞತೆಗಳನ್ನು ಅರ್ಪಿಸುತ್ತೇವೆ. ಕಾರ್ಯಕ್ರಮ ಯಶಸ್ವಿಯಾಗಿ ಮೂಡಿಬರಲು ಶ್ರಮಿಸಿದ ಎಲ್ಲ ವಿದ್ಯಾರ್ಥಿಗಳಿಗೂ ಹಾಗೂ ಅಧ್ಯಾಪಕೇತರ ವರ್ಗದವರಿಗೂ ಧನ್ಯವಾದಗಳು. ಈ ಕಾರ್ಯಕ್ರಮವು ಸೊಗಸಾಗಿ ಮೂಡಿಬರಲು ಸಹಕರಿಸಿದ ನಿಮಗೆಲ್ಲರಿಗೂ ಹೃದಯಪೂರ್ವಕ ವಂದನೆಗಳು.
So we thank all the experts from KIDWAI Memorial Hospital for this wonderful awareness talk session. We have 2 buses from KIDWAI the buses are equipped for conducting breast and cervical cancer screening. So the parents, we see a few parents in the auditorium. So we request these students to take their mothers, aunts, whoever has come with them to the screening camp which is being organized in front of Shashwati Auditorium. This screening camp will go on till 5 o'clock in the evening. So the other students who have not got their parents, or not got their mothers, can inform, and the doctors will be available on campus till 5 in the evening. Thank you all. Thank you for being with us. Thank you.